and just breeze through some of the highlights you have received already. An annual report, which has extensive detail in it, and I just wanted to take the opportunity to give our final annual report and have an opportunity, if you will indulge me, to acknowledge the great work of our legal team, the Office of General Counsel, and also the working relationship we've had with the board and our district colleagues. So as you all know, the school board, the superintendent and leadership, and the school districts and administration are all recipients of our legal guidance, day-to-day representation, and legal representation. This year's focus, when we started, we were raring to go. We had a lot of focus on our equity and diversity issues. We had our training programs, student discipline and safety, and a lot of things we were ready to jump in with running in the beginning of the year. Then March of 2020 hit, and we had to pivot along with the rest of the world to deal with the global pandemic and those challenges. We immediately went to a remote operation. Every single one of our district, of our Office of General Counsel staff went on remote status, and we had a very robust plan to keep everyone on track and working closely. I think we had the most incredible rapid response, seamless working relationship with the district team, and we anticipated a lot of issues that were having legal impacts to the way we were doing business. We created protocols and ways to react to and anticipate legal issues and their impact by the pandemic, including emergency policies and support with the reopening plan. We had attorneys monitoring our state and national work groups in various venues, and a lot of very heavy lift came out of our Office of General Counsel to assist in some of those work groups and some of the development of those white papers, such as the Council of Great City Schools and the ESC and IDA issues. We did an extensive and careful tracking of executive emergency orders, which, as you all recall, were coming out rapidly and presenting a lot of pivoting and responses by the district and board as those went forward. Numerous issues were responded to. Some of the highlights regarding student travel reimbursements. We had to completely change our service of process to receive claims and lawsuits from the building, student discipline, distance learning, compliance with state mandates. All of these issues, we had all hands on deck, and every single member of the team was poised to address these functions. We also had to continue our day-to-day operations and handle a myriad of cases, issue information to the board, and continue what we always do, and we had almost 2 parallel tracks of work. We continue to issue over 140 legal memorandum and opinions to the board alerts, our Legally Speaking newsletter on the horizon, and other of our supportive information and advice. We were really working closely this year, and I want to emphasize this, with the invitation that we had to participate in the superintendent's executive cabinet, which was at least weekly, and then during pandemic, I think it was every day. And we were able to present over 40 different presentations to executive cabinet that were intended to provide either lessons learned, upcoming cases, decision-making points, or compliance issues, and we really appreciated that. Support to schools and administration continued with our duty hotlines and other case reviews. Our Legal Resource Center really was sort of the apple of my eye, to tell you the truth, because it really represented a lot of proactive work and advice that we presented by way of trainings. Our legal podcast program, where we had guest podcast stars by our principals to kind of go over lessons learned and issues that we had learned together throughout the year, including workplace bullying, custody, social media and records requests, and the like. And so that program was really great. And I know it will continue. So having an in-house team saves the district about $4 million if we budgeted out our salaries for our in-house staff, and the attorney hours that it would cost for outside counsel at a very arbitrary and low rate of $250 an hour. It would be well over $6.5 million that you all would be spending, so you have a savings of about $4 million. In terms of volume, we review over 1,200 contracts a year. We have the duty calls and legal hotline where we answer questions for principals and school centers, over 700 annually, and we have over 119 active litigation matters. We have a proactive approach to litigation. We save money with our defense of risk management cases by doing those in-house and save approximately $1 million from outside attorneys' fees. We have an in-house appellate practice that has saved us money, and we've gotten some great results there. As you know, we approach our case litigation management in a manner that proactively looks at our case budget. We monitor our cases, and we have a litigation team that continues to monitor those and make sure that we have a handle not only on the cases, bringing them to you, keeping you up to date, but also looking at the budget, and we try very hard to stay within budget on anticipating those fees. Our risk management costs have gone down over the years consistently from 2013, where we had over $400,000 in outside expenses for just the risk management cases, and now we're down to about $6,000. Special outside counsel fees this year were more than we typically had due to a couple of extraordinary cases, including the charter school referendum challenge, which exceeded $300,000 in outside fees, and that case continues in the appellate courts, as you have been advised. Our risk management litigation trend has continued similar to last year. We have a number of cases, over 290 claims a year, and we've closed those out. Our office has developed an Office of General Counsel Diversity and Equity Plan, and we really try to emphasize courageous conversations, in-house team work with facilitators. We've had a couple of facilitated conferences this year for our own in-house team, and then we do work within the community on a statewide level and in the profession to enhance our work in the area of equity. And we also do a special emphasis on our law academy at Palm Beach Lakes, where we sort of adopted that academy and mentor the students and teach them. So our groups are excellent lawyers and support staff individuals that work in teams in the areas of governance, academic, risk management, appellate, and the like. I wanted to take a couple of minutes at this time to really acknowledge the board, my district colleagues, and my amazing team. To Dr. Fenoy, thank you for inviting me to your executive cabinet and for taking the time to listen and consider the efforts of myself and my team, even when it sounded like all we had to offer was bad news. I appreciate the working relationship we've developed and the professionalism of your executive team. I sincerely feel that in the coming year, under Sean's leadership, the effective use of general counsel will be embraced and enhanced. I thank you for your confidence, support, and positive working relationship, and I wish you all the best, knowing that the district has within it a deep bench of caring educational professionals who really care and strive to do their best. As to my amazing legal team, wow, I just don't know how to express my gratitude, pride, and commendation for your professionalism, expertise, and excellence. Some of you have been with me since we founded this legal team department back in 2002. Jean Marie Middleton, Denise Salgerholm, Bruce Harris, Blair Littlejohn, Kim Hall, and Laura Pincus. Others were quite brilliantly recruited and hired by my successors/predecessors, the late Gerald Williams and former General Counsel Cheryl Wood, and I commend them for their brilliant picks, particularly in hiring Sean Bernard and Eric Bell. Over the last few years, we've added some remarkable new talent: Sean Fahey, Melissa McCartney, Lisa Carmona, Holly Hahn, Lisa Coring, Danielle Williams, Yolanda Morgan, and Patricia Morales. This team of attorneys is extraordinary, not only in their areas of expertise, but their dedication and commitment to the work, their authenticity as caring human beings, and their commitment to the community. Our support team is equally as stellar. Our paralegals, Leslie Alexander, Mary McKenzie, Anna Jordan, Marisa McCreary, Tanya Gilmore, Patty Nabel, and Kenya Suarez, along with legal assistants Linda Flower, Mary Quesada, Veronica Velez, Dawn DeCua, Dottie Fairbanks, and of course, my executive assistant, Miss Deborah Floyd, who are the ones who really make the magic happen behind the scenes. I know each of them will continue to strive to do their excellent work on behalf of the board, the district, and the students we serve. Team, I've put a lot of pressure on you. They really hate it when I say I've got a really good idea. You never let me down, and I thank you from the bottom of my heart. Finally, as to the board, it has been a true honor to serve you. You've each challenged me to think, to do my best, and to lead my team well. And I am always and will be humbled by your confidence and support in me. I will have personal calls with each of you to talk in the next day or so, so I'll leave my personal remarks for each of you to that time. As a board, you are exemplary and made up of extraordinary individuals who care and who will always lead with passion and commitment for this community and for the students we serve. You've been the voice for the voiceless, for children of color, children with disabilities, immigrants, the calling out of economic and racial inequities. You've been the voice of the underserved, the voice of fiscal accountability, the voice of fairness and fidelity, and of doing the right thing. Even when it was hard or unpopular, I commend each of you and the board as a whole. It is particularly befitting that I address you as I sit under this backdrop of the words of my mentor, the late, great Bill Malone. And in these challenging times, I know that you will all work and continue to work now more than ever to keep our eyes on the prize. Thank you. Thank you so much. 10 minutes to spare, Mr. Barbieri.
Yes. For those of you in the audience, we were running short on time, so I asked Mrs. Rico to be quick. I feel sorry for the transcriber that had to get that down. Maybe you could hand your notes to somebody afterwards. Mrs. Rico, we're all going to have an opportunity to say our personal goodbyes to you. Tomorrow, thank you to Mrs. Whitfield, who scheduled a Zoom retirement party for you. But I do want to say that for those of you in the audience that don't know, Mrs. Rico is moving to Italy. She's leaving Saturday, and she's going to relocate her life to Italy, back to the ancestry home for both of us. And I'm sure that I'll be seeing you there because I've already been to your place in Castiglione Fiorentino. It's a beautiful little town on top of a mountain that, I mean, who wouldn't want to live the rest of their life looking at that backdrop? But I do want everyone to know that we have your evaluations here, and of course, you know, the board feels the same. All of us feel the same. You've done a superb job as our school board general counsel. You've served us well. You've served the district well, and you've served the children in this district. All 7 of us gave you above expectation, as you would expect. So, thank you for a job well done. So, board members, I need a motion to accept the evaluation of the general counsel, the above expectation. Motion by all 6 board members, and I can't make a motion, or it would be 7, and it is seconded by all 6. So, discussion. I'm sure all of you would like to say something. Again, we have a few minutes because the board meeting starts at 5. Mrs. McQuinn.
I wrote a little comment on your evaluation, just saying that, well, my goodness, now she's made me teary. Just saying that as the newest board member for just a little bit longer, you know that sometimes I can be off the cuff and a little irreverent, and Julianne would always just look at me, just like with her eyes say, just watch it. But seriously, sitting next to me, I can't tell you how many times I'd say, am I allowed to do this? Am I allowed to do that? And so even though I've known our school district for so long, I didn't know about board stuff. And so I so thank you for your guidance and your support and your friendship. And let me echo your words back to you. You are exemplary and an extraordinary human being. And I'm so glad you get to see your son soon.
Mrs. Whitfield.
No, I get 10 seconds, but I'm going to miss you so much. I really do look to you for guidance so often, even in things non-legally related. It's been my absolute pleasure to get to know you and to work with you. And I'll say more tomorrow, but I just have to say that the way you led the Office of General Counsel. And when I saw you win the Diversity Award, it was just meant so much to me to have you in a leadership position and showing us all how to lead and how to create an office that is truly diverse and truly cares about people. And I just want to say thank you so much.
Ms. Brew?
Thank you. So I'm not saying goodbye, and you're only 6 hours away, right? And you do have WhatsApp, right? So just so you know, we're still going to be talking. So definitely, the only difference is I'll probably be less tempered when I get crazy about stuff, but I will still be turning to you for advice and guidance and friendship. So again, I'm not saying goodbye. I'm saying ciao, and I'm going to say that I will see you in Italy. Thank you.
Mrs. Andrews?
And thank you, and congratulations, Julianne, on your retirement. Now you can make your own schedule and do what you need to do. And just going to Italy and being back home with your son, wow, it's exciting things ahead for you. And the work that you've done here in Palm Beach County, I had an opportunity to work with you at a lot of different levels, and you've been consistent. You really know how to churn the work and make sure that those that's working around you or a part of your team, as we work together, you give us accurate information. So congratulations. You're free to do your thing. Okay.
Dr. Robinson?
Thank you. I really don't feel like this mushy stuff right now. So let me just say that, I remember you both times, right? And so we both changed, right? We both grew, we both learned. And let me just say that I appreciate our arguments more than I appreciate our agreements. Best wishes to you.
Mr. Shaw?
Thank you. Again, I'm not going to say goodbye either because we get to do this again tomorrow. I think that the most important thing that I have gotten out of having the experience of working with you has been that sense of comfort and security, that when we as a board and individually get recommendations and positions, even though we don't always agree and we question why do we have to do it this way, it is a reassurance that I think is so important to the public. And I think when you leave this district, I think that reassurance and that comfort and that security that we have is something that you should remember forever and ever. Thanks.
I'll talk to you more tomorrow. So you stop crying?
And I'd just like to say, as a 2-year, as a young superintendent, as a young person in this role, if we're telling the truth, we've been in a pressure cooker since day one. And so no one will ever really understand the late night conversations that 2 employees of the board have. And I'm just going to leave that right there.
All right, board members, we need a motion to adjourn the workshop, and we start the board meeting in a few minutes. Motion by Mrs. Andrews, seconded by Mr. Shaw. All in favor? Opposed? Motion carries 7-0. Thank you, Mrs. Rico. We'll see you tomorrow. Regular meeting of the School Board of Palm Beach County to order at 5:10 p.m. Mrs. Bass, will you please call the roll?
District 1, Barbara McQuinn. Here. District 2, Chuck Shaw.
Here.
District 3, Karen Brill.
Here.
District 4, Erica Whitfield.
Here.
District 5, Frank Barbieri.
Here.
District 6, Marcia Andrews.
Here.
District 7, Deborah Robinson.
Here.
All right, we have all 7 board members present, so we have quorum. Also joining us at the dais today is Superintendent Dr. Donald Fenoy, General Counsel Julianne Rico, Inspector General Teresa Michael, Board Clerk Carol Bass, and Palm Beach County Student Council President Santiago Alvarez. Senior staff members will join us periodically as directed by the superintendent. Viewers and listeners can access the meeting today by either watching on Comcast Channel 235 or by using the YouTube link on our webpage at palmbeachschools.org. We also offer a listening-only option, which the public can access by calling 561-357-5900 or toll-free at 1-866-930-7015. The meeting ID is 1-561-880-1124 #. The meeting is being transcribed by a closed captioner, so remember to speak at a reasonable pace. Will everyone please stand for the pledge led by Student Council County President Santiago Alvarez.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to welcome the public speakers who are joining us in person today. I'm required to read this, so don't take it the wrong way, please. While your attendance here at the board office is appreciated, please be mindful of important safety protocols that the district now has in place to conform with COVID-19 safety guidelines. Please respect this cautionary warning that in the event of interference with the orderly processes of the meeting, failure to follow the safety protocols and procedures, or otherwise disruptive conduct, this conduct will result in removal of the person from the meeting. Please abide by these protocols so Palm Beach County School Police officers do not have to take action. Board members, we have no minutes to approve. We have 2 items that have been added for good cause. BRD 1, General Counsel's Annual Evaluation. Good cause exists to add this item as this is the final board meeting for Julianne Rico as our General Counsel. And item P2, Personnel Addendum. Good cause exists to add this item to allow for employees to begin in their new positions as soon as possible. Mr. Superintendent, do you have any items to withdraw?
Mr. Chairman, I have nothing to withdraw at this time.
Any items pulled from consent agenda? Mrs. Bass, any board members want to pull anything at this point? You'll have another opportunity, okay? We need a motion to approve the agenda. Motion by Mrs. Andrews, seconded by Ms. Brill. Any discussion? All in favor? Opposed? Motion carries 7-0. Board members, do you have any disclosures or abstentions? Seeing none, Mr. Superintendent, comments, board comments, and superintendent comments.
Yes, sir. Well, good evening, everybody. Today's a great day. I saw kids in classes today, this morning, and it was amazing to see just how thankful our children were to be with their teachers in their classrooms and to see, and it was very, very wonderful to see how our teachers have adapted to teach kids both in the classroom as well as online. So I'm thankful to all those schools that I got a chance to visit today and the classrooms that I got to see. But for the board and for everyone else, last week our board, I heard you loud and clear. You know, one of the things is I've taught people to lead across this country is you have to remember as a leader, you should be in a perpetual state of improvement, or what I call a continuous quality improvement cycle. So using your board comments from last week, I understand and realize, realize that increased communication has to move forward as we now transition from all of this development for the last 6 months into actually implementing our plans. You know, so I will be sharing today district reopening resources and school support, including a review of common, frequently asked questions at the request of our board chairman. These resources are in addition to numerous bulletins and principal town halls shared during the summer months. I recognize there's always room for improvement, but I have always and always will be committed to working that problem. So some of our resources. Once the Florida Department of Education approved the August 2020 plan, let me back up. Once the school board approved the plan and then ultimately the Florida Department of Education approved that plan in 2020, we began to operationalize the reopening plan. It was an all hands on deck approach and creation of our opening resources. So here you'll see 3 of those resources that I will speak to. Our websites, our innovative learning plan that was ultimately approved, and then lastly, our COVID-19 guiding document. And this is very important because I want the community to understand that this document is the one that we update regularly with the most up-to-date information, which can be found on our website. I also want to talk about our decision-making. So for me, and we have some guests here today that will speak to some of this, but in my world, my decision-making was part of, I created what I call the Health Advisory Committee. You know, we were able to create and develop emergency policies that were adopted to ensure protocols were standardized and approved by the school board. We also had several board workshops around our reopening plan, including one focused on operations in preparation for brick and mortar openings. On the slide, you'll see those dates. We had our health advisory committees that were launched in June of 2020, and those are still ongoing. Our emergency policies were adopted on the 10th of June. August the 19th and August 26th, and those for employees, students, and visitors. And then, as I stated, our operations division created a workshop in August of 2020. I'm also proud of the fact that the team created several helplines that are available for parents and staff. These are out there in multiple languages. I've shared these during previous board meetings. Parents, in addition to reaching out to your child's school directly when you have questions, don't forget our back-to-school helpline is also available to you. We have additional hotlines or helplines dedicated to HR, IT, and our mental health services department. I think it's important for us to discuss the reopening support. We centralize this process for all 179 schools. Principals receive daily updates from the deputy superintendent. We have heard from 81% of our students. If a student has not indicated a choice, the district will plan as if the student will be in person on September 21st, 2020. Parents can change their choice via the student portal at any time. But let me be clear, those requests must be submitted a week in advance to give our principals and schools time to prepare for your arrival on their campuses. I also want to talk about our other centralized processes for the entire district. As of September the 15th of 2020, over 2,300 applications has been received, with close to 2,000 reviewed by district staff. And the Human Resources team has developed a dashboard, which is indicated here, which was shared with principals and regional offices this past weekend. So one of the things I want to speak to on this particular slide is the processes that we've been discussing over the last few weeks and the implications of those. So we currently have 1,448 teachers eligible for distance teaching under the school board policy that is currently being developed. We have heard the board consistently say that schedule changes to students should be kept at a minimum to avoid disrupting their learning. While I don't currently have a breakdown of the approvals by level, let's assume that a third of the approvals are from elementary, a third of the approvals are from middle school, and a third of those approvals are from high school. A rough estimate of the schedule changes that would occur based on these numbers are as follows. High school would be 24,100 schedule changes. Middle school would be 19,320 schedule changes. And elementary school, 4,830 schedule changes, for a total of 48,250 schedule changes. Keep in mind that this is just the start of the school year. If 2 weeks after the school year starts, only 15% of the remote teachers are called back as students return to school, that will result in another 14,475 schedule changes. While I remember saying to the board, I'd like some time to examine this with the team, I should have been more forceful about the dangers of moving hastily when it comes to complicated policy. I promise you, I promise the board, after speaking to them individually, and I promise this community, I will be more forceful in the future. Another thing I want to talk about are the dashboards. The boards have been asking us, the board members have been asking us to create dashboards. So I want to run through some of those at this time that will be launched, if they haven't already. So we have the Distance Learning 2.0 dashboard, created by the Research and Evaluation Department along with Educational Technology for principal and principal supervisors, which allows them to visualize key metrics and make data-informed decisions. Another dashboard would be our COVID-19 dashboard. Now, this one is in production. We talked about it at our last meeting. I committed to making it happen. I think a board member referenced a dashboard in Hillsborough County. And so our team was ahead of that, and we have developed that. And so they're in the process of finalizing those documents. We are communicating with the board on what that dashboard will ultimately look like. But based on board feedback last week, this dashboard will help the public keep informed about COVID-19 cases in schools. We will be very transparent about every case that pops into the schools in conjunction with our health department. Principals were also provided with a COVID toolkit on school health during a meeting this week with the deputy and his team. We have also developed collaboratively with the healthcare district and Palm Beach County Department of Health to ensure principals are supported with contact tracing and quarantine protocols. Dr. Alonzo and Dr. Andrew will be speaking to this later on today, and I want to thank the team, the academic team, for working so closely with those individuals to create these protocols for our schools. This partnership will help us out tremendously, not if, but when COVID cases appear in our schools. Now let's talk about our supports. So the regional reopening support. The regional teams, in our structure, we have regional offices. Our regional teams have been very hard at work supporting principals on a more local level. You remember, at the end of the day, decisions closest to the schools matter the most. Here are just a couple of the resources that they have developed. These checklists represent best practices for school reopening readiness. Principals meet with their principal supervisors regularly to discuss and finalize plans. Regional offices are critical to helping principals operationalize the guidance and resources developed at the district office level. Regional superintendents are also part of my executive cabinet, and they provide me and other district leaders with constant feedback to improve our policies and protocols. And again, these are just two of the resources that they created for their teams to keep track of the work along the way. So I wanted to share this slide with you to talk about our decision-making and communication process. You know, part of this reality of going from March to now and the transition, so you have to remember Palm Beach County is an amazing school. We're an A-rated school district, and it's for a reason. And part of that reason is that the principal as the school level leader, that's the model that works for us. And so we have seen some schools rise to new levels of success because of effective principal leadership. Principals know their schools, they know the surrounding communities, and they know what it takes to raise student achievement in their schools. The role of district and regional offices is to support our schools and principals. I've been very transparent that there is a learning curve when it comes to this COVID-19 experience, because part of what the challenge is what is it that we hold tight as a district office, and then how do we continue to respect the realities of autonomy at the school level? And COVID-19 threw a monkey wrench in that, because there have to be certain consistencies, obviously, because we're all learning this together, and I don't expect all 179 principals and their teams. And let me take a moment to say that our principals are only as good as the teams that they have at home as well. So all the assistant principals that have been walking, hanging stuff from ceilings and putting tapes on floors and sweeping and mopping and filling bottles, I have to give them a shout out too, because as I visited principals the other day, there was always 2 or 3 assistant principals right behind them, making sure things were getting done, and also calling ahead to let them know that I was here. But with that being said, we've worked through that, and I think we're getting into a better place. But what I want to clarify where decision-making authority lies as it relates to the different levels of leadership we have here in Palm Beach. For the larger community, we're humongous. We're the 11th largest school district in the country with 23,000 employees and over 194,000 children. And so with the organization that large, you have to have these different levels of decision-making in order to make sure that we get these things done. Specifically, how do these levels of leadership, the district office, the regional office, and the individual schools principals work together to provide a world-class education for all of our students, even in the midst of a worldwide pandemic? Again, the goal has always been to balance the need of centralized functions and principal autonomy as much as possible. Part of this, the reason why I'm kind of passionate about this, I was a high school principal. And as a high school principal during my time, I created the strategic plan that led to academic outcomes in my building. The district office was there to support us. They guided us. Now, again, if we did something wrong, they came in to check us. But at the end of the day, when the superintendent, the regional supervisor, whomever walks out the door, the building and the keys belong to the principal. So when something goes wrong, you can call me, but I have to call the principal, because those are the people that live it day in and day out. So on this slide, you'll see the district level decisions. These are examples of some of the decisions district leaders have been tasked with making in response to COVID-19. And you can read all those there for yourself. Per the chairman's request, there were frequently asked questions that were more prominent on social media and other sources that I was asked to read to the community so that we can get some clarity on some things that have been, I think as Dr. Robinson once said to me in recent weeks, that we have to educate the community, but the problem is, as social media and people start to make stuff up when they don't know. And then that becomes reality. And so then we're fighting against something that we didn't create, and at the same time trying to push out the right message. And so we still have to figure that out in the midst of this crisis, but that's part of this challenge, because even for us, one of the reasons why the Health Advisory Committee was so important, it was to translate all of this medical stuff so that those of us as educators can begin to figure out how to operationalize that. Now, of course, over the course of the summer, as I've said a million times, every hour, every day, every week, everything seems to change. So having a group like the Health Advisory Committee was so important to help us keep up with the changes. So here are some of the questions that I want to share as a result of the request of the board. Question 1, are face coverings required all day? This information is found in Policy 5.326, page 13 of the COVID-19 guiding document. Let me pause right there, because I really do have to give all praises to Dr. Glenda Sheffield, who began this process without any provocation of my own, and made sure that we were ready when the time is for the rest of the departments to plug in their parts. So this would be our guiding document moving forward. So I have to take a moment to give her credit for the work that she did. We have websites, FAQs, and social media. All personnel and students are required to wear face coverings all day. Exceptions or accommodations, including a plastic shield to face coverings, must be verified by a treated licensed medical physician as required by ADA or Section 504 of the 60 Rehabilitation Act and agreed to by a compliant 504 team. Individuals are allowed to remove the face covering in order to eat and during other certain times, but should cover their face immediately upon finishing a meal or snack. The district will provide up to 5 washable face coverings per student. Now, I want to be clear about this. We had a discussion earlier as a team about the costs of COVID. So we bought 5 washable masks for every student in Palm Beach County, in addition to all the other PPE. And I want to just say loud and clear, part of our future challenge is continuing to provide all of this. And what I mean by that, we have to keep track of the money, because as we're just in the first part of the COVID experience. And so we just have to make sure that we're clear, we see what works, and we keep providing these essential protections for our kids and employees. School-based staff, excluding police officers, school police aides, and food service workers will each be provided approximately 10 washable face coverings and 1 clear face shield. Additional PPE for school-based staff working with medically fragile is being provided by the district as well. Question 2, are face coverings required during PE? That information is found in the FAQ sheet. Scopes and sequences for physical education classes have been adjusted so that the standards for the first month do not require strenuous physical activity. Since students will be sitting in class learning standards or engaging in activities that do require strenuous physical activity, students need to wear face coverings. Once students start engaging in physical activity and they can maintain social distancing of at least 6 feet, they may remove the face coverings. It is recommended to the extent possible to engage in physical activities outdoors. Another frequently asked, number 3, the number 3 most frequently asked question is, will students bring district-issued devices to and from school every day? This information is found in our FAQ sheet, also on our social media platforms. Students should bring their district-issued devices and power charger with them to school each day and fully charge their devices every night. I hope my child realizes that as well. To the principal of my son's school, please know that I just told him to charge it every night. Schools may store and charge student devices at school for younger students. I think that's important. So our principals realize for the babies, we may have to own some of that. And so they are working with their families on that. We have provided power strips for charging devices. Power strips and charging devices can be purchased by schools from the marketplace as needed. We talked about this earlier. We're doing our best to open up our marketplaces so our principals can buy the things necessary that they feel to meet the unique needs of their campuses. All schools are expected to have a 1-to-1 student device ratio by mid-October 2020. With many schools meeting the goal prior to that, the 1-to-1 student device ratio goal will be met sooner than originally anticipated, pre-COVID, in light of the urgency to fast-track this work. Question number 4, how will simultaneous in-person and virtual instruction work? This information is found on the FAQs, page 16 of the COVID-19 guiding document, our social media platforms, and we have graphics of suggested classroom setup. Teachers will educate students attending in person and those participating virtually. Students in physical classrooms will receive live face-to-face instruction. Devices will be used as much as needed for independent work, accessing online textbooks and programs such as iReady, and to submit assignments through Google Classroom. Students in distance learning will participate through Google Meet. All classrooms are equipped with web cameras to show live instruction. Teachers will use audio enhancement microphones so they can be heard properly. Smart panels will be used when available to connect virtual and in-person students. Let's take a look at this slide of the imaging that we provided so you can see what classrooms actually look like. So on one side, you actually have a diagram. On my left, you actually have what an actual classroom, what I saw today in many of our classrooms that I got to visit today. All these classrooms are equipped with web cameras to show live instruction. All teachers, again, have the audio enhancement, and all elementary and middle school classrooms have this smartboard technology, and the distribution still continues with our high school students. And let's talk about school-based decisions, the school-level decisions. Here are just some of the examples of the type of decisions our principals have to make during this COVID-19 experience: developing their master boards, scheduling faculty meetings, designing classroom configurations, overflow and isolation rooms, holding open house events for parents, creating videos to show parents what the school day looks like. Principals have been proactive in getting their faculty members ready for both distance learning and opening our brick and mortar. So let me show you an example on the next slide. So here's an example of how principals are sharing important district level and school-based level decisions with parents and faculty. This is a teacher reviewing their reopening information at their school. Many principals have also created video presentations for parents. In addition, this information is being shared during open houses, and they're taking place throughout this week. I would also like to take a moment to thank teachers for all of their hard work over the summer months to prepare for reopening of schools, both in distance learning mode and now in brick and mortar. We know teachers and parents still have questions about what the brick and mortar reopening plans look like. But let me stress again to you the importance of understanding these frequently asked questions. Again, the board asked us to review these, so let me go to the next set of frequently asked questions at the principal level. Question 5, how will overflow spaces work? Information can be found on our FAQ sheets, page 16 of the COVID-19 guiding document, social media platforms, and there's actually videos associated with this. In order to meet social distancing guidelines, students may be asked to temporarily attend classes virtually from another space in the school. Students will tune into their classes through technology for that class period, and they will be supervised. The location of overflow spaces varies by the school. Some schools may not need to designate an overflow space. Students attending class in the overflow room will be rotated, ensuring that the same students are not always going to the overflow room. Example of good spaces used for overflow rooms include auditoriums, auditorium lobbies, gyms, cafeterias, and other common areas as designated by the administration. Question number 6, where will students be treated for illnesses? Now, you'll hear more about this as a presentation later on today, but this information can be found on our FAQ sheets, page 22 of the COVID-19 guiding document, and there's also a video associated with this as well. School clinics will operate as normal. Students with suspected COVID-19 symptoms will be isolated in a separate area as determined by the school site, while they are waiting for their parents to pick them up. Question number 7, how have schools been modified to maintain social distancing? This information can be found on FAQs page 15 through 16 of the COVID-19 guiding document, social media, and videos. Students will practice social distancing from the arrival on campus through departure. Staggered arrival and dismissal schedules may be utilized in an effort to allow for social distancing. Students will move in controlled patterns throughout the day based on procedures as described by each individual school. Schools have designed classrooms to meet desk spacing requirements starting at 6 feet apart, and as the need arises to additional students in classrooms, schools will follow the guidelines as outlined by the CDC and the American Academy of Pediatrics. And lastly, again, I started with saying the board had major concerns about communication, and so do I. So I, over the weekend with the team, said we're going to create a communication action plan. And so despite all of that's been shared with the community in terms of reopening resources, we know that there are still gaps. The questions coming to the board office are very specific, and we want to make sure individuals are getting answers from the appropriate level of decision-making, whether it be from the district office, the regional offices, or from the individual school principals at the school level. So with that, I want to close out my board comments tonight with an immediate action plan related to communication. This action plan is meant to address gaps related to decision-making and communication, and is offered in response to the board's feedback last week on this very topic. It was part of several one-on-one conversations. The chairman and I had one last week, where we also discussed the possibilities of this action plan. I will be asking my chiefs to put together similar action plans for their divisions, because continuous quality improvement should always remain at the forefront of our work, especially in times such as COVID. We will continue to work with problems presented to us while remaining open to feedback on where we can do more. This action plan is evident of that, since it is my strong belief transparency about the process matters just as much as the decisions being made. I have said it before, and I will say it again. The most complex problems will not be solved by a select few. I need everyone in the district to pitch in, and I welcome the feedback, because it will only make us better. Mr. Chairman, at this time, those are my comments, but I would love to, at this time, turn it over to Dr. Andrick and Dr. Alonzo for their presentation. Thank you so much.
I'm going by age. Good afternoon. Can you hear me okay with my mask?
Yes.
Okay. So I'm going to start off by just giving you a little bit of an update, and then I am going to, we have a video to present, and Dr. Andrick will say a few words, but basically we're here so that you can ask us anything you want. I've had a little bit of practice with the Board of County Commissioners, so that's why I'm talking first. All right, so as of this morning, we have 4,459 cases, positive cases, to date here in Palm Beach County. That's 154 more cases today than we had the day before. Our total number of patients hospitalized so far since this began is 3,512. Those are 7 new hospitalizations as of yesterday. And we have 1,234 deaths, which is 18 new deaths since the last time we had these numbers. Now, specifically in the deaths, it's very important that at least all of you understand, and everybody that's watching this, that the deaths are put not on the day that we get that number, but on the day of the actual death. So when you see the numbers, the little columns changing, is because for at least 2 weeks, those numbers are being added where the person actually died. So if I die today, I go to the medical examiner's office or I go to my doctor and they decide to bury me. It takes a few days for that case to get reported. When that report comes in, the date that that death will be put on for me will be today, not by the time I get buried, okay? So that's been a problem that some people have because they say the state is changing the numbers. No, that is how vital statistics has always worked since the beginning of vital statistics. They get put on the date of death. So that has been confusing for some folks. The other thing that we have that we've been following very closely is our positivity rate. And there are 2 rates, and the reason we use a rate is so that the number of tests do not interfere with the number going up or down. It's a percentage. One rate is the total number of people since this began in March who have been tested positive divided by all the people that have been tested. That bucket is only 2 buckets, positives and negative people, cases. So when you hear case positivity, we're talking about cases, 2 buckets. You're either positive or you're negative. You do not get counted again if you're negative, and you would not be tested positive again if you're positive, right? So that goes from, the only way it would change would be a person who is negative and gets tested again. Now he goes into the positive bucket. All right? So that number is a big, big fraction with a very big denominator, right? So it's going to take a long time to get that fraction to start coming down. Unlike the daily positivity, or I try to add the word lab, the daily lab positivity number, which is the one that tells you the number of positive lab tests for that day divided by the total number of tests for that day. So there's nothing retroactive there. There's no past history from yesterday or the day before. It's that day. That's the number that I like, that we want to be below 5%, because that tells you the amount of virus that is circulating that day in the community, okay? And the reason we picked 5 was not because Dr. Alonso likes the number 5. It's because it's been determined that that is a number that gives us effective contact tracing. When you're doing contact tracing with numbers that are 5 or 14 days old, you can't trace anything because it's already passed, and you can't prevent anybody from becoming positive. So now our tests are coming in about 2 days. We had a little dump the other day of some tests that were 54 days old. Hopefully they were negative tests, thank God. but that is going to skew some of those numbers, and so those numbers have to now be replaced by these. Our staff has to go through, it's about 200 pages of labs, and they have to go through line by line and pick up the duplicate tests by their names. And we did that. We found several duplicate tests, and so we corrected. So the number of for Palm Beach County, the number of the total people tested, the big fraction, is 12.77%. That number has been coming down steadily from 18, 15, and slowly started coming down. And it's been going down almost every day. A few days it stayed stagnant. The other number, the daily lab positivity, is at 4.04. It has been below 5 for the entire month of August. Okay, that's a very good thing. And at first, everybody was very skeptical that we would ever get below 5 because the state set the goal of 10. That's okay, but we want to be below that. And we knew we could achieve it because when we reopened the first time, we were at 3.9. So we knew that we could continue to go down. The virus will not go away. The virus will not disappear. H1N1 happened, a pandemic that happened in 2009. Guess what's in your vaccine with the flu vaccine this year? We put the vaccines in there because H1N1 circulates around the world every year. That's what viruses do. This is not something new. This is how viruses work. So they don't go away. They continue to circulate. This virus will be around for a very long time. Hopefully, we can get a vaccine that we will be able to decrease the level of the circulating virus, but with both sides being so polarized, I'm afraid that those who are against vaccines are not going to take it, and those that are for vaccines but want FDA approval are not going to take it because it hasn't been tested on people. So right now, it's only about a 21% that we expect people to take this. That's not a good percent to try to get rid of the virus. So as a result of that, we're going to be dealing with this for a long time. H1N1 didn't go down until the third year, and there was 2 waves. And I bet you that none of you, because you've probably looked it up now, but I bet you none of you even remember what happened in 2009. And you might not even remember H1N1. I named my cats, my 2 cats that I got that year, I named them H1 and N1. But my kids couldn't tell the difference. And I said, what do you mean you can't tell the difference between H1 and N1? And they called them Black Kitty and Gray Kitty. Guess what stuck? Right. Gray Kitty and Black Kitty. And so to this day, they're still called Gray Kitty and Black Kitty. But I remember it because I remember doing all the statistics and all the stuff that we're doing now by hand and handing it to Dr. Malecki so that we could follow the virus and do the things that we did. H1N1 was not as complicated as this virus. So every virus is new, and we're still learning about this virus. Yes, we've been doing this since March, but it's a new virus. And so there's a lot to learn still about it. So yes, sometimes we change our guidance, or we change the way we look at it, or we change and say, yes, we need to wear masks, because we're learning about it. Okay? And 2 or 3 years from now, we will know a lot more about it. So our positivity rate is right where it needs to be in both our total and our daily rate. We're going to do everything we can to continue doing effective contact tracing. The county has hired community health care workers that are going out into the areas where we have higher numbers of positivity explaining to the people as they're having their tests done, as they're going out into the community, that we're going to be calling them. Our telephone numbers say DOH. We have signage up. We have instructions that we give to the people having their tests done, explaining to them that we're going to be calling, why we're calling, what kinds of questions they need to answer, so that we can catch those persons that they're in contact with and quarantine them as quickly as possible. That exact mentality is what we're going to be doing in school. We're going to be giving to us the positive cases. We're going to have a COVID team here that will be, we will be able to contact and get information from. We're going to be calling the families of the children who test positive, and we will need to know where was that child sitting, who was the teacher, where did they go, where did they have lunch, did they ride the bus, what seat were they sitting in. So it's critical that those seating charts and those bus charts are accurate and that the kids sit where they need to sit. Why? Because we don't want to put out your entire class. We want to do this surgically and precisely, okay? We're going to ask, was the mask put on? Was the child wearing the mask the entire time? Was the teacher who maybe become positive, was she wearing the mask the entire time? Those questions are critical so that we can minimize the number of people that have to go out into quarantine. Now, ideally, we would be able to have rapid testing, which is now available, in the nurse's hands, so that nurse, when that child comes with the coughing or maybe a fever, we could test that child, call the parent, give permission to test that child, and say he's positive or he's negative. If he's negative, he's still going to have to go home because he still has a fever, but then we're going to have to do, we will instruct the parents and we will instruct the school and do everything that we need to do in terms of the way we do contact tracing. That's not going to be left up to the principal or left up to anybody else. We're not going to be closing down schools. We're not going to be closing down classes. Okay? We're going to try to do it precisely based on the contact that has existed. Now, why is that good? It's good because you're going to be sending a lot of kids home. Okay? Because there's no difference in the symptoms during flu season, especially that we're going into. The difference between a COVID and the flu or just the common cold. Sneezing, coughing, fever, achy, even diarrhea. Is it COVID or is it norovirus? Are we going to have to clean the school or are we going to send the kid home, right? So all these things, everything else that happens during flu season still has to be done through our epi department, and that's what we're here for. That's our expertise. You're going to be able to rely on us to do this. The healthcare district has the responsibility of, they hire these nurses that are at your school. We were the first county in Florida to have a nurse in every school, and we were very proud of that. That happened in 1997 when we made that arrangement between the health department that's responsible for the health actions that occur in any school, the healthcare district that hired these nurses and put all these nurses in place, and the school board that supports this and helps us. We had something unique. Other counties have tried to copy it. Everybody does it a little bit different. And those that don't have that now are calling me, how did you do that? How did you do that? I said, well, it's not just snap your fingers and do it. It took a lot of work, and we're very proud of what you have here in Palm Beach County. So we should be thankful for that. That's going to be a big help to the school and to the kids in terms of how we proceed. Are things going to change? Of course they are. Have you ever made a plan that you didn't have to change it 10 or 20 times? Any of you? Even in your home, right? Even when you go shopping. I go shopping for milk, I come home with $50 worth of groceries. Don't take me to Home Depot because then I really have to spend a lot of money. So this is the process that we're going to go. It's messy because it's real, because it's science, because, we're not doing anything to get rid of the virus. What we're doing is mitigating the probability of you catching the virus. That's why the masks, the distancing, washing your hands, not touching your face, the 3 C's, stay away from crowded spaces, large crowds, all those things that we have been saying is to mitigate, to reduce the probability of getting the virus. You can't stop it completely. But we can, obviously, through our numbers, you see that Palm Beach County has brought this virus down to a level which we can now be confident that we can send our kids to school, be confident that we can teach and provide these services that we're providing, and the choice for the parents who can afford to keep their kids home, and they can do that. That's great. I think that the kids going to school, I know Dr. Andrick, you're going to make your statement. Her daughter's definitely going to school. I don't know what she's been doing at home. She wants to get rid of her so bad, but she is going to school. So I am very optimistic that when we look back at this, we will see that, yes, this was hard, this was difficult, but in Palm Beach County, we always take care of our own and we always move forward in a good direction. So I'm very proud to be part of this group, and I'm here for any questions that you may have. I will let Dr. Andrick follow me.
Thank you. I think at this point we should play a video, and then I'll be present for. I think at this point we should play a video. They told me that I can say that we're going to play a video.
I'm Dr. Charmaine Scheibar, Medical Director for the School Health Program for the Healthcare District of Palm Beach County and Pediatrics Director for CL Bromback Primary Care Clinic. Our school nurses staff more than 200 registered nurses in nearly 170 public schools and serve more than 180,000 students from pre-kindergarten to 12th grade. The Healthcare District has been providing input on reopening schools. We have been working closely with the school board members, the superintendent, and key leaders to develop protocols around returning to classrooms. In preparing for the school year, we realized that this year will be unlike any other previous year due to the COVID-19 pandemic. As a result, we will need to adapt and change the way our school nurse program provides care for students in schools. For instance, the traditional use of the health room this school year will be modified in order to focus on students with suspected COVID-19 symptoms. Strict protocols for infection control and social distancing will be followed, and access to the school's health room will be restricted. All students with respiratory, gastrointestinal, or just general symptoms of feeling sick will be evaluated by the school nurse in the school clinic space. The school nurse will perform a screening and decide if student needs testing. The nurse will also perform testing once test kits are available. We don't have tests on hand at present time, but we are working on having a test at each school clinic in the near future. Sometimes this assessment is not easy, so the nurse will be able to consult the Healthcare District's Incident Command team in real time, where physicians like myself will be available for guidance, much like telemedicine service. The school nurse will also help to schedule COVID testing at one of the testing sites available in the community. This can be time-consuming, but the school nurse will try to have it scheduled before students leave the clinic. In order to prioritize school nurse duties to respond to the COVID-19 crisis in our school settings, other duties related to non-acute or non-emergency medical conditions will need adjustment. If possible, teachers should call the school nurse or school district designee before the student leaves the classroom. Our goal is to decrease the movement of students throughout the school as much as possible when a health concern can be managed in the classroom. Depending on the type of symptoms and severity, a student may be referred to different locations to address his or her particular health concern. For example, those students who have other medical needs such as acute injuries, mild illnesses, medication administration management, or other procedures will be evaluated in the satellite area. This area might be just a hallway or office outside the health room and equipped with a cot and privacy screen for confidentiality. This area will be staffed by a school district designee if possible and will be in close proximity to the health room. It is anticipated that a school nurse will be occupied with COVID-19 assessments in the health room for the majority of his or her time. The school nurse will not be able to monitor and care for students in both locations, but will be available for consultation with school district designee when possible. Since medications will continue to be stored in the health room, it will require coordination between the school nurse, the school district designee for continuity of care for the students. Strong teamwork and communication are necessary for successful outcomes. Students with suspected COVID-19 symptoms will wait in the isolation room until parent pickup after they have been screened and assessed in the health room or satellite area. The isolation area will be monitored by school district designees in separate location from the health room. If the school clinic is large enough and if it is not occupied by students waiting for COVID screening, students can wait there for parent pickup. It is very hard to anticipate the volume of COVID screens that nurse will have to do on a daily basis, and if 6 feet cannot be secured in that area, then an overflow isolation room will have to be used. It is also recommended that all staff monitoring the isolation room should wear personal protective equipment or PPE. Students who are not already wearing a surgical mask will be provided one upon entrance to the room. The parent or guardian of the ill student will notify the school upon arrival and remain in their vehicle. A school district staff member will escort a student to the vehicle. As you can see, this year will require very close coordination and communication between school staff and our school nurses. These protocols have been designed to mitigate the risk of COVID-19 in the school health setting, protecting students, teachers, school staff, and nurses. Throughout the school year, we will continue with close collaboration among the healthcare district, the Florida Department of Health, and the school district of Palm Beach County.
Hello, my name is Dr. Alina Alonso. I'm the director of the Department of Health in Palm Beach County. Brenda Galley, my director of school health, and I have been involved with your school for many, many years. It is our duty now to become very involved in the stopping the spread of COVID in the schools. In order to do that, we will be working closely with a school nurse who will be giving us information for any case or any child that comes to her who may be a suspect of having COVID. The child will be able to go get tested at many of our clinics or through their own private doctor and decide whether they're positive or negative. If they are positive, they then become a person that our epidemiology department will do contact tracing. Now, what does that mean? That means that we will be quickly and very methodically asking questions to determine where the child was, where was he sitting, was he wearing a mask, what classes did he go to, where did he eat at lunch, did he ride a bus? Many questions to determine the extent of the other contacts that he may have come in contact with. So this will not only make sure that we catch all the possible contacts, but it will also help us to eliminate the need for closing down entire classrooms, and certainly we do not want to close entire schools. In addition to clearing a person or one of the students, we will also be able to determine how many days that child has to stay home in quarantine, what other members of the family need to stay in quarantine, and how quickly they can return back to school. This will keep the number of kids out of school to a minimum. So this is a win-win for us in terms of stopping the spread, and a win-win for the school district to be able to keep your business running and people feeling safe and confident that we're doing things precisely and with the science and help that they need to get it done. Thank you very much, and we'll be seeing each other soon.
Hi, I'm Belma Andrick. I'm Chief Medical Officer of Healthcare District, Palm Beach County. As you could already hear from Dr. Chebar and Dr. Alonso, our agencies came together and worked with the school district leadership in order to help you better prepare for this very unusual school year. we try to define a little bit better what the school nurse role with the COVID is. You could also hear from Dr. Chebar that those school nurses' primarily job this school year will be to identify who are the children with suspect COVID cases. Nurse will coordinate care of those children in a sense that she will perform screening, determine if that needs to be tested, and then coordinate testing. Nurse will also follow up on the results of this testing. Once the result is obtained, and if the result is positive, nurse will communicate to health department this result. From that point, health department will do contact investigation like we could hear from Dr. Alonso. Those contact tracers will identify all close contacts to that child and also recommend isolation or further testing. Health department will also communicate to you what is the earliest date that all those children can return to school. That completes the cycle of following up on COVID case. Dr. Chebar also talked to you about need to having satellite area that will be preferably in a close proximity to the health room because will require teamwork and strong cooperation between school designee and the nurse. We also talked about isolation area, and I know that many of you, as we speak, are identifying those areas in your school. Our organization will provide PPEs for your employees that will be working in satellite area and isolation room. I heard that many of you have fears how to staff isolation room. That fear is very normal, and many of us that are working in a COVID pandemic from early March have the same fears. But as a healthcare professional who use PPEs on a daily basis, I can tell you that I feel more safe when I'm wearing PPEs at work than I feel in my regular life. I'm also a parent who is sending a child next week to the school. Thank you for taking my teenager back. But I wouldn't send her if I don't feel that she's gonna be safe as long as she wears face masks, maintains social distance, do the good hand hygiene, and listens all instructions that you provide her. For that reason, I feel that whoever works in the isolation room, as long as they wear personal protective equipment, they will be fine. So thank you. I hope that working together, we will do the best that we can under those circumstances. And I hope that our chain of communication will stay strong and we will deal with situation as soon as we encounter them. We are here to support you and we are here to work as one team. Good evening, everyone. As you could hear, we really worked diligently in the last few weeks with school district leadership, health department leadership to come with a plan that everybody feels more comfortable because we have clear delineation of duties. Especially for healthcare professionals, we realize you are educators and not necessarily knowing all those healthcare rules and regs that we should implement while dealing with this unprecedented pandemic. And I think that this delineation of duties will help principals and school administrations really have that help that they need on a daily basis. And I think that with defining what nurse does, who is doing contact tracing, who is defining when the child goes back to school, will lift that heavy lift off the shoulders of the principals. We have incident command actually starting operating today. As Dr. Chebar said in the video, we have physicians readily available for nurses and school employees for any question. We have calls today. We have kind of first run, and it was successful. We already conducted 6 screenings. There are 6 children sent to the health room today to be screened by the nurse. 1 child was sent home. He had a cough and runny nose. Mother picked him up, was cooperative, and said she's going to take the child to pediatrician for testing before he comes back to school. So it works in that sense. We hope that as time progresses, that incident command provide good guidelines for everybody. It's not easy always to determine is it COVID suspect or not, but I think as a team we will provide a good support for our boots on the ground. I just want to share with you that this was a very
heavy lift, but very cooperative team that worked on this plan. I cannot say thanks enough to your leadership, especially Jay Bogus and Mr. Keith Oswald, who are here tonight. I think that they had a crash course in medicine last few weeks, and my team says we gave them honorary M out of MD. We're still working on that D, but it was very pleasure to work with. They were very receptive, listened what we had to say, act really quickly. Many late evening meetings and weekends, but I think that together we came with a solid plan. I'm here for your questions.
Thank you, Dr. Zandrick and Alonso. Board members, you have questions for either of the doctors? Mrs. Whitfield?
Thank you so much. Thank you, both of you. Dr. Alonso, I do know where I was in 2009. I was working for you. So I'm well aware of where that was. Two questions I wanted to ask. I wanted to know if you guys can talk a little bit about the impacts you've seen around the country when schools have opened and how much you expect the numbers to go up. And secondly, you mentioned the person that's going to be out in the hallway doing acute issues, like a broken leg or something like that. Are we giving training to that school district employee that's going to be doing that? Do you have any idea, or maybe that's a question for the superintendent?
So school designees are trained, and I understand, I'm going to let Dr. Alonso talk more about it, but as per Florida statute, school already have those designees. If the nurse is on a lunch break or is not that day in a school, they are trained for that. If not, they will be trained. But it's not really that acuity. Nurseville still responds to all emergencies and work closely. It's just if you have a COVID kid in a room, that person will receive that non-acute medical condition and kind of keep them until the nurse is available, because we have to separate the space where we address COVID and the space where we address chronic medical condition. That's why we came up with that satellite area that is just outside the health room, so they can work as a team. But nurse should not have that child in the same room where she does assessment of the COVID.
Thank you.
Mrs. Andrews?
We had a second part of that question. I think Dr. Alonso is going to answer.
Her second part, because I have to pay good attention to her because she was my former employee. So, let me answer the school question maybe in a different way. What we have seen here, first locally, from the private schools that opened earlier and the universities that have opened, is that there are few cases in elementary, daycare, middle school. It's high school. It's that, you remember that age? Do any of you have the kids at that age now? When they start going out and they get fake IDs and they go to places that they're not supposed to go to. So it's that crowd that is becoming positive. Unfortunately, maybe they don't have so many symptoms, but they spread that in the home and to the other relatives. It coincides exactly with the age distribution that we have for COVID, and you can see that report in the floridahealth.gov under the county report. If you go to Palm Beach County on page 101 and 102, that report shows you that 55% of the new cases of COVID are in that age group between 15 and 44. A lot of those 44s are the ones that think they're still 20 partying like they're, well, anyway. So the point is that the biggest numbers are at the university level. So what we have seen across the country is a very similar example, that what is causing the spread is the large crowds, tailgating, football games, areas where lots of people are congregating. They're having fun the way they should have, and they're partying, they're drinking, they're speaking loudly, they're speaking over the noise of the music and so forth. And so the virus is spreading very quickly among that age group. Fortunately, in Palm Beach County, that age group has not had a huge hospitalization or deaths. There have been few, but it has kept our death rates significantly down. The majority of the people that die have coexisting conditions, and they're in the 65 and above age group. So with our schools, I think that knowing that gives us an advantage as we're opening a little later than some of these other schools to be able to anticipate those issues and address them not only in the school, but also in the community. So one of the things that we've been doing is we have the COVID education and compliance team that are going out to the businesses that we suspect are doing those types of activities. And in fact, we first go and we educate them, and then if we come and visit them again, if we see that they haven't complied, they get one more chance, and now we're fining them. And I spent the last 2 Wednesdays, today and last Wednesday, in the hearing boards for the code violations with a magistrate that is giving fines to these businesses that are refusing to comply by maintaining their doors open after midnight and having huge parties where people are drinking and having a good time, but spreading the virus. So we're doing, not only are we taking care of the school, but we have to take care of the community and all those events. I know my son's up at Tallahassee, and FSU is having a terrible time. And my son said, I get information wherever I can. I said, so Alex, what's going on at FSU? He goes, Mom, they're partying like there's no virus. Okay, so it spreads very quickly in the dorms. It spreads very quickly among those parties, at the bars. And if any of you have ever gone to Tallahassee, it's definitely a bar party town, right? I mean, you go from bar to bar down the street. And so it's no wonder that you have the perfect environment for this to spread. Now, maybe those kids won't die, but again, one of the issues that I've been very persistent in saying is we don't know what long-term effect these children will have. So this is not the kind of virus that you want to fool around and just get it and get it over with, okay? Certainly, I don't want my kids to get it. So that's a little bit of an answer in terms of universities having the higher numbers, the lower grades having less effect.
Mr. Barbieri, may I just finish following up on that a little bit more? I was curious because what I'm concerned about is that the community is going to see an uptick, and I want to know, what would be considered an abnormal, concerning level uptick for you when the schools open, and then what are you anticipating? What is something that you think we can handle as a community? Does that make sense? Maybe I asked the question badly.
We have been proposing that question to the commissions over and over again. We do not want to wait as long as we waited last time, but we know that we're going to have to wait to see a pattern occurring. We're not going to jump and close everything down the moment it goes to 5. So by keeping that level of that 5% and below, what we want to see is that it maintains. It may go up and down a little bit, but we don't want to see something that's continuously rising like we did when we opened up last time. And we just watched it go up and up and up and up, and we were just watching it. So it was very frustrating to sit there watching it. So what we've all agreed is that we got to jump on it right away, and hopefully we've gone down low enough for a long enough time, which is why we did not open phase 2, open everything. Because if we open everything, we don't know what's causing it. So the fact that we're able to open up schools now, we want to give it some time. I'm hoping for 4 weeks. I don't know what I'm going to get from the commission, but I'm hoping that we will have some time to see the effect of schools. If we do things right, we won't have an uptick because of the schools. So
thank you very much.
That's the answer.
Board members, if we don't stop the discussion at this point, we're not going to get the agenda speakers in before the non-agenda speakers have to speak, and we have a lot of delegates and other people here to speak. So if you're all okay with that, we'll end this at this time. So Dr. Alonso and Dr. Andrick, thank you so very much. We certainly appreciate the partnership. I know it's going to help our principals and our school-based staff to handle all the things we could anticipate. So thank you for coming tonight. Dr. Fennoy, I first want to thank you for taking the time tonight to answer those questions. As you know, the board office is getting thousands and thousands of emails, and a lot of those questions, I'm not sure how people aren't getting those answers, because I know our communications department, especially Claudia Shea, has done a superb job of getting the information out there, but I was hoping that the people that are watching tonight will see that, and I'm glad you were able to show them where it's at so that they can go and find that stuff on the website. So thank you for taking the time to do that. The school district of Palm Beach County finds itself in a challenging position as we sit here in our meeting tonight. Our obligation and responsibility has been and always will be to educate the almost 200,000 students that attend our public schools. I emphasize with the teachers, principals, parents, and other staff who are trying to find certainty in both their professional and personal lives. My colleagues and I on this board want that certainty just as much and are working hard to provide it. And I know from my private meeting with the superintendent and his staff members today, excuse me, that they understand that we must bring this uncertainty to that end. I visited 17 of the 21 schools in my district since Friday. I saw principals and their school-based administrative staff had done an exemplary job of preparing the campuses for the students' arrival on Monday. I saw every classroom that I visited had desks spread 6 feet apart. I saw an isolation room in every school. I saw many of our dedicated teachers using the equipment in their rooms to teach children at home or otherwise preparing their rooms for the children arriving next week. I saw custodial staff were hard at work, the floors were shining, and the rooms safely cleaned. I saw our police officers ready to keep our children and staff safe, and our food service staff still outside in the heat, handing out food to our families in need. I'm sure my colleagues saw the same situation in the schools in their districts. It has not been easy. Everyone involved in educating our students has been tested in ways we could not have anticipated. We strive for excellence in providing the best education for our students. We're not where we want to be at this moment, but now is the time we must all come together and work collaboratively and find the solutions needed. As C.S. Lewis once said, you can't go back and change the beginning, but you can start where you are and change the ending. Let's not let our students, our customers, suffer because our process hasn't been perfect. Let's work together to chart the course forward. The future of our students is dependent on us getting this right. I'll now yield the floor to my colleagues. Mrs. McQuinn, if you'd like to go first.
Yes, Mr. Barbieri, thank you. It's been a good day so far, productive. You know that I typically hesitate to call out for praise or thanks to any particular employee group or a school. However, I had such a good morning this morning. It would explain, though, why I appear to be under the weather right now. It's nothing more than being out in the morning humidity waiting for a school bus. I wanted to ride a school bus today. I live in Tequesta, so I took the bus with one of the stop was actually at an individual student's home, and it was warm and it was humid, but I have to tell you, the bus driver was so wonderful. And then the bus aide, buckling the kids in their car seats, school bus seats. I think that they chose a bus they knew I would get on because it did have the air conditioning and the Wi-Fi. And the lovely little places for the wheelchairs. But it was such a great experience to be on the bus. And my only regret, if the bus aide is looking, is I did take a little gift to the bus driver, not thinking that there would be a bus aide. But it was great. And then I took the bus to Watson B. Duncan Middle School. They serve many of our North County exceptional students. And the kids were excited. The school didn't know I was coming, which I wouldn't typically do, but we didn't know until yesterday. So anyway, I did also get to walk around with Mr. D'Amico, called by everyone Mr. D, and the classes were amazing. The markings on the walkways, and really the cafeteria. I did not know that Mr. D'Amico had been a former stager at Disney for like all the events, so he kind of knew how to move stuff around. Anyway, I just wanted to tell you how excited everybody at the school was, and I know how very much work it has been on the part of everyone. And in spite of all of the drama that is external to students, our schools are getting the job done, and I very much appreciate that. Thank you.
Mrs. Whitfield?
Thank you so much. I wanted to, first of all, start my comments just by saying it's so nice to see everybody. I know it's been a really long time, and I've just been really excited to come back to the building, and it's such a pleasure to get a chance to see everybody face-to-face, even if we're covering half our faces. So I wanted to mention a couple of things really quickly. Like you, Mr. Barbie, I actually got to go to a school today, a little harder with an infant, but I managed to make it to one today, so very happy about that. And it was such a pleasure to see how much they've prepared for school starting. I really do want to say thank you to the principal who hosted me today, because there's nothing like seeing it with your own eyes. And I fully expect that our families are going to be pleasantly surprised when they see next week how things are going to look. I have to say a huge thank you to all of the staff that have been working so hard. I know that this is a disheartening time. It's a really tough time to work for this school district because we are so unsure about how the future is going to look. But I want to let you all know that I remain hopeful. I remain hopeful during all this, and I am really holding on to that now, because I feel that there are too many good people here, and they are working too hard for this not to work. So I believe that we are going to do a really good job coming up here next week. And like Dr. Andrick mentioned, I am sending my daughter. She's actually going to ride the bus, so I'm fully going all in. And I'm hopeful that it's going to be great. And I do believe in our staff, and I think that they're going to do a great job. I want to ask the community to please let us know, and the community includes our teachers and our staff, our administrators. When there is an issue, please bring it to our attention and give us a chance to fix it, because I know that my colleagues and I have been responding to every email we possibly can, along with the staff at the district who've really made a valiant effort to answer every question. Please give us that opportunity. Ask us the questions so that we can get back to you with the answers, because I think it's the only way we're going to deal with the issues going forward from today. Finally, I wanted to say really quickly, welcome to Santiago. I know you should be up here on the dais with us, and I really want you to have a very special year, and you have a wonderful time with us here. So hopefully things will get back to normal soon. But I want to say thank you so much. He's our student representative from Student Council, and from, unfortunately, Boca High School. And one of these days we're going to get somebody from District 4. I just can't wait. Thank you so much.
Ms. Brill.
Thank you. So first I want to say that it is wonderful to see my colleagues and all of you again face to face, or maybe I should say mask to mask. For those of you who are celebrating this weekend, Shana Tova, I wish all of you a happy, healthy, and sweet New Year. As I sit in this boardroom, former Superintendent Bill Malone's words echo in my mind and are actually on the wall in front of us, as Ms. Rico mentioned earlier. Focus on the prize. The prize is the safe reopening of our schools, with the safety of our employees and students being the utmost priority, the top priority, and we're doing that. Today proves that. I've learned over the course of my lifetime that in the heat of the moment, when emotions are running rampant, it is not the time to make rash, critical decisions. That's not to say that problems and concerns should not be addressed. It's that I personally find it better to act thoughtfully when the dust clears, so to speak. Our Palm Beach community is a strong one. I've always said that it takes a village, and we have a wonderful village, especially in our school district. I want to assure everyone, our parents, our employees, especially our administrators and our teachers, that we will get through the challenges together, and as always, we will be stronger and better for it. Thank you.
Thank you, Ms. Brill. Mrs. Andrews?
And thank you. And it's great to be back to see everyone right here tonight. We've been through a lot of challenges, but we can overcome. I was so happy to see the students start school today, our ESC students, to see the teachers, the custodians, the bus drivers, the principals, everybody working together for the children. It truly is always about the children. It rests within the school itself. That's the heartbeat of what we are about, making sure our children are educated. And now with this pandemic, COVID-19, it's also about health and safety. And tonight, to be able to hear the healthcare district and the health department, this is something I've been talking about for a while. Dr. Alonso came once before, and just to go through the questions tonight and have her tell us all about what's going to happen with testing, contact tracing, and how we're going to take care of children as well as adults to make sure that everyone's safe, that's truly very important. And it takes the whole village to make it work. And especially in a pandemic, everybody has to be all hands on deck. And to hear the communications clarification tonight was an improvement. This is what we have to stay on top of so that people will understand what's going on. I'd like to commend the district staff. You've been working tirelessly to get this information on the website, and now we want to make sure that every parent understands exactly what the expectations are. Everybody doesn't have a computer, so we've sometimes will have to go door to door to kind of make sure that people know what's available for them. It's a big choice to decide whether you want to come back to brick and mortar or whether you want to stay in distance learning. But parents do have a choice, and as of next week, they'll be able to take one of those choices. Our teachers should be able to be taken care of too. They're still out there, some of them, worried about what's going to happen to them next Monday. They need to be a priority. And not just the teachers, the non-instructional staff that's worried about maybe an underlying health issue. We've got to make sure that we spend the time to educate them and help them to know that we truly need their service. They work for the school district of Palm Beach County, and we want to make sure that they're healthy, they're safe, and they can be able to work. We don't want to take anybody's work away because of this pandemic. We want to keep them employed as much as possible. And this month, we are celebrating Hispanic heritage, and I will be reading that proclamation, and we know that we have a lot of work to do for all children in Palm Beach County, but this month, we are celebrating Hispanic Heritage Month. Thank you.
Thank you, Ms. Sanders. Dr. Robinson?
Thank you, and good evening, everyone. So, I don't know, I feel like we're in this place in what to me feels like a horrible position in a pandemic, forced to open schools with reports of preparations being incomplete. And like many of you, I'm angry, I'm sad, I'm anxious, and I'm disappointed. But I have not given up. We have got to do better. I pray that we will. It seems as though our workers on the ground, whether custodians, bus drivers, food service workers, teachers, principals, or many others, feel like they've been invited to the sunken place where their voices are marginalized and their concerns minimized. I feel like I received the same invitation, but fortunately we did not sink into the floor. We have resisted the hypnosis, and that is good because your voices must be heard. We must hear you because you are the people that make the wheels go round and round. We must hear you because you are the ones that will look at the little ones that we purport to serve and help them even when you're hesitant or even scared. We must hear you because listening to you with our hearts and our minds and doing the best that we can to act upon what we learn from you will make this school district a much better place. And I am clear that you did not lose focus on the children. I think we might have. There's a lot of blame going on, and I think that we each own some of it, some more than others, some much more than others. But we are in crisis. For me, blaming at this point is counterproductive. We can do that later. So make your notes on what went wrong, because at some point in time, we must do a retrospective in order to learn. And please include my missteps in your notes. Now, if I conclude that there's something rotten that must be cut off in order to move forward, I will say that. Hopefully, I won't need to say that. And I certainly hope I don't need to say that publicly. So let us be about the business of repairing what's broken. I know that we won't make everybody happy. I don't even try to. But what hurts my heart is that so many people are afraid for their lives, and I understand that. My son got tested today. He wasn't feeling well, and I was holding my breath waiting for the results. Thank God it was negative. My fear might be a little bit more informed than yours. And for my principals and teachers, don't expect to see me visiting in the short term. I'm here to tell you, I am concerned, but I'm not as concerned as I was a few weeks ago. I had hoped that we would delay the start of school until the true daily positivity rate was consistently less than 5%, and the lower the better. I'm waiting to see if we have a post-Labor Day spike. I pray that we won't. I expect to see a bit of an uptick after schools reopen. I pray that I am wrong. We individually and collectively can make sure that I'm wrong. So let me be clear. We must have overlapping layers of protection. Let me say this clearly. You've heard it before tonight, but it's 6 foot social distancing. It's not 3 feet. It's 6 foot social distancing, and use every available space, but let's set the schools up for 6 feet. I know that one day too many students will come back to school to make 6 feet impossible. So let's work on 5.5 feet. Let's do as much social distancing as we can. And we must wear our facial coverings, which means we must teach our children why they should wear facial coverings and stay 6 feet apart. Because many of them are like I was, where "'cause I said so" doesn't work. We must teach our young people why we are asking them to go to these unusual lengths to stay safe. We must wash our hands every 1 to 2 hours. We must wipe down those high-touch surfaces. And I hope you can operate your schools in the cohort pods. That's been proven. In addition, as one of my colleagues said, please tell us where we're falling short. I know of a few of the things that trouble me that I've been hearing recently. Some schools have not received their plexiglass barriers for teachers' desks. Got mine. I'm not clear what safety measures we will be taking on buses. That's important. I think that it is really unfair to ask principals to have to choose which teachers work remotely. I believe that's a central HR function. I believe there's room for us to create a central office, organized remote teaching pool. And yeah, I expect us, Palm Beach County School District, to make a way out of no way to match the children that want to learn remotely to the teachers who want to teach remotely. And if we can't do it, I need somebody to prove it to me. Prove it to me. And I understand that we still have children without devices. So, Mr. Superintendent, I ask that you create a hotline of sorts, another one, so that employees can call and report where they don't have the things that they need from us. We cannot control everything, but we must control the things that we can. And we must do it in a way that respects the people, including those that are not called first responders, but should be respected as such, because they turn on the lights, they put the key in the ignition on the bus, they unlock the office, and they teach the children. They run this place. We are their support. We don't run this joint, and we must support them. And so for everybody who's upset about what's going on, let me ask you a root cause question. Do you have a voting plan? Thank you.
Mr. Shaw.
Thank you very much. I know that several members have talked about some of the schools that they visited, and I want to do a shout out to one of the schools that I visited that I think really represents the hard work that's being done by our principals and the teachers and the employees at the school. Everglades Elementary I went to, I believe it was on Monday, and must be somebody here from Everglades Elementary. But I went to that school and we walked through the building. We looked at all of the provisions that have been put in place that the staff worked on during the summer. When I got there, there was a significant meeting going on with the staff, with some of the staff, talking about all the things that they have done. They showed me all their little blue lines. I was impressed with the custodians being able to make that straight a blue line down a hallway of 100, 150 feet. And also went in classrooms to see what the teachers had done with setting up their classrooms for the arrival of students next week. But one of the most important things I saw was a commitment from a group of people who had worked together to make a successful opening for their school. And my guess is that if we went to all 187, whatever our total number of schools are in this district, we have people out there that have committed everything they have for the last several months to do the very best for the students that will be coming to us next week. And at Everglades, they also had a packet that was going to be given to every teacher that answered every conceivable situation that they could think of during the course of the day, from somebody falling and getting a scraped leg and how do you handle that in the clinic. Every contingency that they thought they needed, they had addressed. And it made me think, in all the years that I've been around, the really test for everybody who's in a leadership position in this district is leadership is making decisions, being consistent, and don't let the distractions be the thing that drives you. And I've seen staff at the district office and staff at the schools that have showed that kind of leadership. And I hope that when we move forward in situations that we just never expected. I mentioned to Dr. Robinson earlier, I said, this seems surreal to be here tonight and going through this. But our test is whether or not we have the leadership as a board and a system to get through this without being held hostage to the distractions that are coming from outside sources. So I congratulate and wish the very best to every single person who will be serving our children next week. Thank you.
So the two of you weren't very fair because I got 17 schools that I visited, and I can't remember all the names, but I saw one of my principals here is Mr. Capitano from a great school in West Boca Raton High School. Is Olympic Heights here too? So with that said, so I'm glad you recognized Mrs. Whitfield, that our student council state representative tonight is from another one of my schools, Boca Raton High School. Santiago, would you like to give your report, please?
Thank you, Mr. Barbieri. As the school district moves into Phase 2 and allows for students to return to brick and mortar, the County Council is excited to help our schools welcome back students and help make the transition from virtual to on-campus learning as comfortable and easy as possible. Throughout these last few weeks, student governments across the county have been working on projects and ideas to assist our school in the return of students virtually and to brick and mortar. For freshmen and new students, many student councils have hosted virtual orientations in which students were given the most important and necessary information for their first year of high school and had a Q&A with members of the school's SGA. Additionally, student leaders published tutorial videos which assisted students in navigating websites frequently used, such as Google Classroom and SIS District Portal. In order to strengthen the virtual bond between students and teachers, we help teachers and staff create videos to introduce themselves to the school community. Some schools have created or are in the process of creating a virtual club rush in which students can get a glimpse of what each club is about. As we continue to get back into our everyday school life, student councils around the county are working hard to increase communication between the school and the students, as our previous methods no longer provide sufficient information. Last meeting, I discussed the historic vote for President and Vice President of the United States, and any election, really. Since then, our student government organization has been working on creating a Google site which houses all information necessary to register to vote. The site will give voting locations, voter registration information, and information on local, regional, and national elections, and will give everyone from our students to our elderly the most up-to-date information on voting. One of the main initiatives this year for our county council is to reach out and work together with all Palm Beach County student councils. In a time like this, it is important to come together and share our best practices so that every single school can succeed. Our county council executive board met to discuss the most pressing issues our schools and council feel we need to work on, and those are school spirit, mental and physical health, fundraising, communication, and we will also be sharing ideas and work done by each council. The first county council meeting will be held in early October, in which we will host virtual breakout sessions so schools can brainstorm, work together, and gather ideas to bring back to each one of their schools. All students and teachers have seen the difficulties that come with online learning, and we will soon be exposed to new regulations as we continue on with a combination of brick and mortar and virtual learning. While these situations can cause stress throughout the county, the most important thing to remember is that this only works if we all keep our heads up, try our best, and make the most of what we have. Student councils have done their best to set this precedent by being active on school-wide social media accounts, posting mental health tips, daily announcements, and motivational quotes. We are looking forward to returning to school, and as always, we thank you for your time and energy that this board puts into all of our students' education. Thank you.
Thank you, President Alvarez. Board members and Mr. Superintendent, Mr. Alvarez has asked whether it would be possible for their upcoming state board, is it a state board meeting that you're going to have?
It's the county council meeting, so it would only be the executive board members.
And how many of you are there?
There's 5.
So, board members, Mr. Superintendent, he's requested whether or not he could use our board chambers to have that meeting here. So I will speak with, unless any of you have an objection, I will speak with the superintendent, see if that can be worked out for him to have his meeting here in the boardroom.
Correction,
okay.
6, sorry.
All right. Yeah, we can handle 6. Actually, we can handle 8.
Perfect.
Okay. All right, the next item on the agenda, thank you very much for your report.
Thank you.
The next item on the agenda is the Academic Advisory Committee, and I understand it's taped. Kavon, can you play that for us, please?
Good evening, everyone. My name is Laura Feldman. I'm honored to speak with you tonight as the chair of the Academic Advisory Committee. In recent weeks, we met twice, once on August 27th and again on September 14th. I'm pleased to congratulate Charmaine Postal on her election as vice chair of our committee. Our meeting on the 27th, we learned about improvements in distance learning that were driven by feedback from parents and teachers. Staff shared that there are a variety of videos on palmbeachschools.org/distance learning to help support parents and guardians during this time. And we also learned about the Palm Skills Academy available in multiple languages, which will enable students to access more materials to support their learning. We also heard updates about the summer learning program as well as the English language learner and exceptional student education programs. Once in phase 2, there can be in-person evaluations for ESE needs. This delay was needed since the evaluation programs are not set up for distance evaluations. During the September 14th meeting, we focused on technology updates and information about face-to-face instruction. We learned about the district's efforts to improve internet connectivity through the Digital Inclusion Project, The efforts to improve community infrastructure to support students' learning are notable. On top of these efforts, the district has distributed over 102,000 devices since mid-March. The district is working to enable each student to have access to a device such that they will have access to them by mid-October. There is not an expectation for students to bring personal devices to school for an in-person learning. Students are expected to bring devices distributed by the district to school daily. By using these devices, the students will be able to complete assignments, read textbooks, and take quizzes or tests. This will help schools to be paperless. It is expected that the devices will not be used in the classroom during class discussions, presentations, or lectures. Also, if and when students are in an overflow room, then the devices will be used to access the online lesson. When asked about how the district is dispelling rumors about what face-to-face instruction will be, staff explained that principals have sent out detailed information to all families, and the district has posted a detailed ebook entitled COVID-19 Guiding Documents with a wealth of information. Thank you all to all teachers and staff who are working so hard to support our students. Have a good night.
The next item on the agenda is the Construction Oversight Review Committee report. Board members, it's attached for your review at a later time. At this point, we'll take elected officials and delegates. So welcome Senator Bobby Powell if you want to come up to one of the podiums. And after that, President James Gavrilos of the Education Foundation and President Alonzo Mayfield of SEIU, in that order. Yes, sir.
Good evening, everyone. Glad to be here. Good evening. Good to see all of the members of the school board here. I don't want to get too close. It's better though, right? All right. Good to see all the members of the school board here. Glad to be out. Myself, I'm not really going out too much in public right now. But I did get an opportunity today. I'm standing here to come before you this evening to just bring to your attention this idea that I know the Palm Beach County Classroom Teachers Association, who I get along very well with and have been supported by and continue to be supported by, would like to see the superintendent removed. I will plead with you to really, really take a look at that issue, because the issue is not just that of the school board superintendent, right? As a legislator, I've had the opportunity, I've been on the phone this afternoon and this earlier part of today with other state legislators who have also seen that particular article. And we are not in support of that. I've been on the phone with other local elected officials, and we are not in support of that. I will say that as someone who speaks to the governor's office on a regular basis, at least twice weekly, we have a call with the Palm Beach County Legislative and Congressional Delegation, and we discuss these issues. The issue of schools reopening is not necessarily the fault of the school board superintendent. But what I will tell you is that, yes, there probably were missteps, but it starts at the top. The recommendation that schools reopen started with our governor. Our Secretary of Education, Department of Education, Richard Corcoran, pushed for this. We know throughout the state of Florida, if we're paying attention, that some schools have already opened and have had to close. Some classrooms have had to close because of coronavirus outbreaks. What I'll tell you is that a few days before our schools reopen, this is not the time to try to be divisive, to try to eliminate this man from this position, as we are in the middle of not only a global pandemic, as we talk about the coronavirus, but here in this nation, we're in the midst of a national pandemic when it comes to equity and racial tension. And what I will say to you is that from the calls that I've had today, I'm not sure how many people want to see Dr. Fenoy removed, but what I can tell you is from my conversations, there's a lot of people that would be very disappointed, as a matter of fact, would probably be downright upset if he were to be removed, and this would cause a lot more tension in the community than we see right now. So my plea for you is I would ask that the Palm Beach County Classroom Teachers Association work with the school board superintendent as well as the members of the school board to right the ship, because what's important is those people who are working in the schools, not just the teachers, the custodians, the bus drivers, the students, the parents when these students have to go back home. Yes, me and as a member of the Senate, I represent 500,000 people in Palm Beach County, the northern parts of Palm Beach County. Palm Beach, the town of Palm Beach, all of West Palm Beach, up to Jupiter and Tequesta, Riviera Beach, Mangonia Park, Royal Palm Beach, all of those areas. And yes, we're worried. I myself, as a legislator, know that there's been 3 other legislators who have had the coronavirus. If I get a headache, I start getting scared. So what I will ask you all today is to really, really look at this, take a broad scale look at this and work with Dr. Fenoy to right the ship, because what's important is the kids, the teachers, and the staff in Palm Beach County schools. Thank you all. I appreciate you for giving me this moment of your time.
Thank you, Senator Paul. Thank you for taking the time to come to us tonight. President Gavrilos, are you here? And after that, President Alonzo Mayfield from SEIU.
Thank you, Chairman Barbieri, members of the school board, and of course, Dr. Fenoy. There is no task a community can undertake, no challenge a community can face that is more important than the education of our youth. We at the Education Foundation are somewhat lucky because we get to get down into the weeds and just do the work of supporting our teachers and making sure they have the resources, financial and otherwise, to carry out their incredibly dedicated work. I appreciate the passion and the emotions that are in the room. Doctor, you spoke to me tonight when you talked about refocusing. One of the things that we've done at the Ed Foundation is just make sure we get back to our core mission, which is bringing this incredible business community of West Palm Beach and uniting it to the world of education. And the business community in Palm Beach County, and you'll hear from Michelle Jacobs later, is solidly supportive of the incredible work that goes on in the classrooms on a daily basis. A couple of examples. Number one, 2-3 weeks from now, on October 8th, we will celebrate our annual Go Teach Grants Awards. 80 teachers will be awarded Go Teach, and this year, thanks to a contribution from the Frederick DeLuca Foundation, Go Reach Awards. Go Teach Awards are up to $1,500. This year, the Go Reach Awards will be up to $3,000. The foundation and business community supporting education in Palm Beach County. This year, our Red Apple Supplies is expanding. We're serving 53 schools, and this year we've added 3 STEM sections: LexisNexis, Aerojet Rocketdyne, and Carrier Corporation have all made contributions to sponsor STEM sections at our Red Apple Supplies, so our teachers can get the scientific and engineering and mechanical type things they need to teach these skills to our kids. The business community celebrating education. And speaking of Carrier Corporation, in addition to setting up a STEM section at Red Apple Supplies, their recent donation will enhance the HVAC program at Royal Palm High School. The business community is solidly behind education, and they want to see our children learn. We've heard about the digital inclusion program to make sure that every one of our kids has not only a device, but access to the internet. And I'm proud to say that we at the Education Foundation are playing a role in that. And we're working with the Economic Council, with Palm Beach County, with the incredible staff here at the district, with Quantum Foundation, and so many others to make sure that 25,000 of our children and their families have access to the internet. Chairman Barbieri, I'm proud to tell you tonight that we've already raised in solid and verbal commitments over $500,000 to make sure that this gets done. This is the kind of community we have here in Palm Beach County. They understand the fact that I learned a long time ago from one of the smartest people I've ever met, a gentleman named David Nicholson. He is the head of the Stiles Nicholson Foundation. I think you know David very well, Dr. Fenoy. And I'd ask all of us here in this room, those of you watching at home, every teacher, every parent, every administrator, to think of David's words. Children make up 20% of our population, but they are 100% of our future. We at the Education Foundation are solidly committed to make sure that every teacher, every school, and every principal has the resources they need to serve 100% of our future. We are your education foundation. Thank you.
Thank you, President Gavrilis. And, you know, I tell you every meeting, but you all become an invaluable asset to the district and to the children. So thank you so much for all you do for us. President Mayfield, I'm sorry, but, you know, my typist typed your name Alonso, and I'm so used to saying Alonso from Dr. Alonso, but I know your first name is Alfonso, so excuse me on that.
It happens all the time.
Okay.
And, you know, y'all don't see me that much, so it's understandable. First off, good evening to the superintendent, Chair Barbieri, the rest of the school board. They're happy to be here tonight. I wanted to come tonight to update the school board on the work of our union since March in relationship to the coronavirus in the school district. Our approach since March has been threefold: to keep students in this county safe, keep our members safe, and keep our members and their communities from financial harm. I want to remind everyone that we're in the middle of a global pandemic. Everyone is scared. If you are saying you aren't scared, you're either lying or you're uninformed. So for us, we have focused on two things: engaging with our members and finding solutions, and trying to remain clear in the midst of medical and electoral madness. This is hard. This is some of the hardest work that we will do in our generation. Trying to work from home with a 6-year-old who thinks that she's a professional fighter while homeschooling is immensely difficult. So shout out to Ms. Rickard, you're doing a great job considering what you have to deal with. And trying to figure out how we make it out of this unscathed is hard. Now is a moment that is asking all of us to lean in new ways, and lead in new ways, and listen in new ways. This isn't a time to change a superintendent. However, it is a time to focus, and it is a time to show a clear vision of how we get through this and how you lead in the midst of danger. However, this is not the message I wanted to deliver tonight. We have work to do, and yes, we are behind, and we need to prepare and be ready for Monday. And if you want to know what our members are focused on, our members have submitted recommendations that address social distancing, cleaning, disinfecting, recommendations on how to keep our members safe while working remotely or trying to work remotely, suggestions around training that could keep our members safe, our food service workers and managers who are concerned about not only the safety of children, but the community at large, and are trying to understand how they're able to meet the charge of feeding children with maybe not enough staff. Our bus drivers feel afraid for their lives, but they are committed to their jobs. Our paraprofessional members fear their jobs and retaliation from principals who, if they dare request modifications or safety provisions, including the same ones that are being extended to teachers. Custodians who are feeling overworked, underappreciated, and are wondering if they're going to have the materials that they need to keep the schools clean. Now, it would be very easy and convenient, and in some ways typical, for our union to blame the district staff and leadership for everything. And trust me, I have absolutely no problem in doing so, as you have seen in the past with certain of the leadership. But that's not what we need right now. What we need is leadership. We cannot panic. Lastly, I would like to say that during my tenure as president, we've had a strong track record of working with the school district on issues as they arrive. However, please do not confuse our willingness to work together as a sign of weakness. We have no problem being loud or aggressive. We do this because our children deserve better. And when our children deserve better, we have to rise to the better angels of our nature and act like the adults that we tell them to be all the time. We have to model that behavior. It takes all of us to make this school district amazing, and right now that's where our focus should be. But any energy that is not in service to finding a path out of this crisis is a disservice to our community and a missed opportunity for us to show what we can be when we are at our best. Everyone in this room, all of us in this district, parents, teachers, staff, principals, superintendent, board, we have to do better. That's what's required of us in this moment. Thank you.
Thank you, President Mayfield. Next is President and CEO of the Economic Council, Michelle Jacobs.
Good evening, Chairman Barbieri, Board, our Superintendent. Thank you for having me. I'm Michelle Jacobs. I'm the President and CEO for the Economic Council of Palm Beach County. I am here not only on behalf of my organization, but on behalf of Troy McClellan and Dennis Grady, Kelly Smallridge, Noel Martinez, and Mary Lou Bedford, who are the leaders of the chambers and the BDB. Collectively, we are the largest business organizations within Palm Beach County. We first wanted to thank you all for the incredible leadership and diligence that you have shown throughout this pandemic, acknowledging that there has been no playbook for this and the tremendous stress that this has placed on you and your families. We also felt it important to publicly state that our support for Donald Fenoy, staff, and the school board has not wavered. As we embark on the next phase of the school year for our students with in-person classes to begin on Monday, we want to stress that it is imperative that we come together as one, working together without divisiveness to get our students, the teachers, faculty, and essential support staff back to work in a safe and productive way. Only when we enter into this crucial next phasing of reopening can the residents of Palm Beach County continue to recover from the setbacks that the pandemic has created. In-person instruction at all levels is another essential part of this critical process. Through collective and collaborative leadership at all levels, we will be successful in bringing our students and staff back safely. This requires courage and true leadership on everyone's part, and while it is not easy, it is achievable. During difficult times like we faced over the last 6 months, communication is essential to avoid misgivings and misunderstandings. To that end, we urge the district to employ all resources to over-communicate during this period of transition back to in-classroom learning. Again, we cannot stress enough the importance of one voice and unanimous support of the reopening process, as it is the only path to recovery, particularly for those residents that have been adversely affected the most. We appreciate your service and sacrifice during these challenging times and want you to know that the business community stands ready to support you and the district in every way that we can. Thank you. Have a good night.
Thank you, Ms. Jacobs. Mr. Ridley, Chairman of Unify. Thank you, ma'am, for cleaning that for us every time. Appreciate it.
You're welcome.
Let's move to Jennifer Jones, Volunteer Association Fund of Florida, and we'll take Mr. Ridley after Ms. Jones. Okay, how about Dr. Anne Marie Dilbert, Principal and Division Chair?
Good evening, School Board Chair, Mr. Frank Barbieri, school board members, and Superintendent Dr. Donald Fenoy. I am Dr. Anne Marie Dilbert, Principal Division Chairperson for the Palm Beach School Administrators Association, representing all administrators. I am standing here with my colleagues in an effort to bring us together and unite us as one rock-solid school district of Palm Beach County. There are many challenges facing the reopening of school. However, we need to get back to the business of focusing on students. The purpose of our letter that was sent to you on Friday, September 11th, 2020, regarding returning to school was to inform the board and senior leadership of the challenges and frustrations that principals are experiencing. As a district, we took the proper course of action to open schools remotely. The political pressure that was placed on the district to reopen brick and mortar was unprecedented. This has caused all employees and community members to fear the unknown. School board members, executive leadership, administrators, and teachers need to do what is right for our students. We all need to be united. The superintendent has acknowledged shortfalls with our plan and is committed to solving them. Principals have been working tirelessly in work groups, creating plans for brick and mortar, creating and recreating master schedules, measuring desks and other classroom furniture, reorganizing lunch schedules, and reconfiguring our cafeterias, placing signs, arrows, and labels all over our buildings, and anything and everything that has been asked of us, we have done. In closing, on behalf of all of the principals and assistant principals of the School District of Palm Beach County, we do not support the removal of Dr. Fenoy as our superintendent, and that was never our intention. We are confident that he will continue to work with all stakeholders to address the challenges that lie ahead. We would like the board and superintendent to know that even though many items are still unknown, your principals and assistant principals remain positive and supportive for change and are willing to provide guidance and input on the decisions moving ahead. We are all educators and have accepted our noble calling to stand up and do what is best for children. Thank you.
Thank you, Dr. Dilbert. Thank you, principals, for taking the time to be here with us tonight. We appreciate it. President Katz of CTA. And after that, Laura Feldman, Palm Beach County PTA.
Good evening, school board members. I am here tonight to do my job and to ask everyone else to do theirs. Nothing more, nothing less. We are in the business of education. It is the view of CTA and many others that this business is faltering and needs help. Not exclusively because of the inherent crisis and challenges associated with COVID-19, but because of a second crisis, a crisis of leadership within our school district. I have tried to voice these concerns for months through collegiality. I have spoken to district staff to try to voice the concerns of our teachers. Beyond that, I've continued to voice their concerns more authoritatively through direct communications and public comments. And today, I stand before you to continue to voice our concerns in an effort to continue to get positive change to make sure that our reopening is as successful as possible. In the past few months, our employees have been deceived, the public has been deceived, and even you, by your own admission on the school board, have been deceived in many cases. This is unacceptable. We have allowed the manufactured excuse that we do not have the time or ability to solve many legitimate problems in our reopening plan, an excuse born out of a conscious decision to ignore other possible options for the sake of expediency over efficacy. I reject this narrative. We did have time. The reality is that the district frittered it away over the summer instead of addressing many of the concerns that have only come to light publicly and been addressed in the past 2 to 3 weeks. We have inexplicably neglected to duplicate some of the most basic and achievable health and safety apparatuses seen in other districts across the country. We sat last week and joked about how we wish the school reopening plan were as detailed and articulate and clear-cut as the athletic department reopening plan. It is a shame that we know more, the public, the teachers, many other employees, about how best to utilize football field space than square footage in our classrooms to ensure safety for our students and our teachers. As leaders, we whisper our gravest concerns in the shadows and hedge our true feelings when presented the opportunity in the public to demand solutions to serious and undeniable problems. We have allowed political pressers to render us mute and blind to the obvious and undeniable holes in our reopening plan, holes that inevitably will lead to outcomes that are less safe than they ought to be. My greatest personal regret today, and I believe many of you share it, is that some of our unpreparedness has nothing to do with COVID and more to do with decisions that were made over the past few months or a lack of decisions that were made. The old saying goes, when you fail to prepare, you prepare to fail. I hear everyone's position tonight. I'll reiterate what I stated the last few times I spoke. I am here to do my job. My job is to keep the pressure on this district, this administration, and this superintendent, as well as you as school board members, to not accept anything less than our best and full effort to make sure school is safe, to make sure the education we provide is sound. I will continue to do that. It is not pleasant. I do not enjoy being this guy, but it is what I am paid to do. And if it produces positive results, you're rewarding my actions, so I'm going to continue to do them. That's just how positive reinforcement works. We all work with children. We know how that goes. So I stand before you again, asking for corrective actions to be made. Those actions are yours to make. If now is not the time, that is your decision. But again, as Dr. Robinson stated, there will be a time to reflect back on the decisions that have been made and determine whether or not appropriate action needs to be taken to hold individuals accountable, because in the schools, teachers are going to be held accountable, and in this building, everyone else should be held accountable as well. I thank you for your time. I stand in collaboration with all of you in an effort to try to make sure our reopening is as smooth as possible. Thank you.
Thank you, President Katz. Ms. Feldman? It's on a recording. Kevon, will you play another message from Ms. Feldman, this time as the Palm Beach County PTA?
Chairman Barbieri, school board members, Dr. Fenoy, and staff, my name is Laura Feldman. I am honored to speak with you as president of Palm Beach County Council of PTAs, PTSAs. I would like to thank all teachers and staff who are working so hard to support all students' education through these difficult times. During this last month, County Council has been busy. During our first general meeting this year, our volunteers enjoyed a wonderful presentation regarding community equity and advocacy by Dr. Tracy Baxley. I would also like to thank Chairman Frank Barbieri, School Board Member Erica Whitfield, and Deputy Superintendent Keith Oswald for attending our meeting and sharing updates about the school year with our volunteers. In the last month, our volunteers have enjoyed a variety of trainings focusing on key issues of understanding our school's data and how to interpret it, on PTA policies and processes for fiscal responsibility, and on Member Hub membership and more. Please watch for future emails and posts announcing our topics for our upcoming trainings. I'm happy to announce our upcoming Family Fun Nights on the last Tuesday of each month, where families can enjoy playing various virtual games together via Zoom. We are also excited to begin an opportunity for students to cheer residents of assisted living facilities by sending cards to them. On October 19th, we'll be hosting a candidates meet and greet via Zoom to help the community be well informed prior to the election in November. If you're interested in participating in any of these activities, please let me know which activities and email palmbeachcountypta@yahoo.com. I would also like to remind everyone that there is still time to register to vote. The deadline is October 5th to register. There is also still time to request a vote by mail ballot. Please go to pbcelections.org for either of these. I wish everyone good health and thanks.
My glasses fog up when I take the mask off, and I got to wait a minute to see what I'm able to read here. That takes us to agenda topic speakers. I know we're out of order on the non-agenda topic speakers, but we'll get to them right after the two agenda topic speakers. That would be Carrie Anderson and Debbie Rang. If you would come up to if you're here. Would you state your name for the record, ma'am, and watch the clock for us, please?
Yes. Good evening, members and Dr. Fenoy. My name is Carrie Anderson. Both me and my husband are teachers at Jupiter High School. This is my daughter, Brooke Anderson. She's a student at Limestone Creek Elementary. I would like to honestly thank the board members. You have worked hard for us, for both the parents, students, and employees. The coronavirus is deadly for many members of the community, and I am one of those individuals. I qualify for Priority 2 remote work status as I possess 3 of the 5 most dangerous medical conditions that can lead to lethal complications if I catch COVID. I began the process of applying for remote work in March of 2020. I waited for 6 months for an answer. Just 2 days ago, I learned that I had been approved by the committee for remote work. However, there was an addendum. The final decision would be left up to my principal. My principal communicated to me that she would allow me to work remotely, but added that she could rescind that plan at any time. She added that she was only persuaded to do so because I have been bugging her since March. 2 hours ago, well, 2 hours before this meeting began, my husband was denied remote work, and any temporary relief that I felt is gone. When he's forced back into the building on Monday, my life is still in serious danger. At a previous meeting, Dr. Fenoy, you told board employees that employees would be granted remote work through a committee. He added that the principal's input would be taken into consideration. However, at this time, it appears there's been a drastic shift in the decision-making process. I asked Dr. Fenoy this question: is the board even aware that if your committee approves someone based on medical concerns, that at any given time, they can be rejected without cause and unilaterally by one person, their principal? Principals come with a position that comes with an impossible list of tasks, and yet principals are now being asked to add one more task to their endless list, to make a choice regarding the literal life, limb, and livelihood of their employees. Board members, I ask you, are you willing to accept liability for the worst-case scenario? We all know someone who's fallen prey to this virus. As Dr. Fenoy has stated countless times, we all work for the students. My daughter, your student, is here tonight. Are you willing to tell her that the life of her mother, her father, and her grandparents is literally in the hands of not a medical professional, but a principal who, at your direction, Dr. Fenoy, doesn't want to upend the master board? What a terrible burden you have placed upon our school-based administrators. Finally, I'd like to address a few statements from Dr. Fenoy. You said today was a great day for you, but I can tell you, for thousands of your employees, it has not been a great day, and it will not be a great day until we feel safe. You complain about the schedules, thousands of schedules being changed, but sir, if you had been prepared prior to the start of the school year, this would not be an issue. Poor planning on your part has constituted an emergency for school administration. Last thing, and I'm done. Dr. Fenoy, regarding the message you sent out to employees yesterday via YouTube, I want to assure you that I have never forgotten that it is my job to educate children. I love my students and my job, but we should not be placed in a position to choose between it and our lives. Thank you, and I'm sorry for going over.
Thank you, Ms. Anderson. Is Debbie Rang here? I can't hear you, Carol. It's recorded. Come on, would you play the remarks from Debbie Rang, please?
Good afternoon, board members. My name is Debbie Range, and I am speaking in support of agenda item L1. I am representing the Palm Beach County Historical and Cultural Society. Your approval of this appropriation for the African American Museum at the historic Roosevelt High School will allow for the continuation of planning and gathering resources for the anticipated museum at Roosevelt. I have appeared before you to share my research about the historic black high schools in Florida that were reduced to middle schools and some eventually abandoned and demolished following desegregation. The positive side of my research also revealed that through cooperative agreements and partnerships with school boards, counties, and cities throughout the state, many of the former black high schools have either been restored to the original building or renovated into community centers or museums. The fate of Roosevelt rests with you and the commitment that has been made with the Roosevelt community. Martin Scoggins said, a people without knowledge of their past history, origin, and culture is like a tree without roots. A museum at Roosevelt is a must to teach, preserve, and display the phenomenal accomplishments of a people who succeeded despite the obstacles. Everyone needs to know the sacrifices made and the strategies used to survive. A museum is not simply a nice building to have in the community, but for African Americans, it is essential. This appropriation will ensure the next steps. The first funding has been documented and all steps of the scope of work was successfully completed. Museums, historical societies, and research libraries draw resources, services, and talent that help sustain local economics while preserving local history. The roots of the history of African Americans and their contributions to West Palm Beach and the county are evident today. As a result of the historic Roosevelt High School, thousands of students were embraced and taught by exceptional minds, and those graduates are continuing to make outstanding accomplishments in the world. With this museum, the next generation will come to know their glorious history and how they are connected to it. I encourage you to support this appropriation by voting for agenda item L1. Thank you.
Thank you. Come on, would you also play Jennifer Jones? She was a delegate speaker, but I just realized that she was recorded.
Dear Superintendent and members of the school board, thank you for taking our comments. My name is Jennifer Jones. I represent the Volunteer Association and Fund of Florida, which is a Haitian 501c3 non-for-profit organization working here in South Florida. COVID-19 has impacted everyone locally and globally. However, we want to address right now the issue of removing our very first Black superintendent here in Palm Beach County. We reached out to many of the parents, and they're not in favor of this political game that everyone is playing against our superintendent. This is a time for the law and not a time for smear politics. Everyone is doing their best, and we do think that includes our governor, and they are yet to have been called to remove him. It is a team effort, and it takes a village to raise a child. We're certain that if a party is asking for the removal of Dr. Fenoy, then his entire team is subject to removal as well, being that they've been elected and selected to work in the court with him. And therefore, it would call for all of them to be terminated as well. The Black community has witnessed for decades the past superintendents that have failed in their leadership, and still they were given opportunity to fix their errors. Then we see in our community that we're asking for the very same opportunity, an opportunity that we've not had during this pandemic. Dr. Fernand deserves some credit for all that he's done to keep our school board, our school system up, and for running it despite all the attacks that's come his way. As African-American leaders and leaders in our community, it is our duty to voice our support to keep Dr. Fernand in his position and to work with him, to work collaboratively to ensure the safety of our students and our teachers. Lastly, we want to focus on our time wisely so that we can improve these situations for our children. This is for the betterment of our children and not to search for a new superintendent or replacement for him right now. And so we stand with Dr. Fenoy, and we ask for you all to stand and support him as well. But thank you.
Come on, would you also play Mr. Ridley? Ridley's recorded a message.
My name is Chuck Ridley, Chair of the Unified Palm Beach County. I am speaking as a delegate. Unify has a very simple mission. We build power for Black people and Black communities. I am calling today in support of Superintendent Donald Fenoy. This may be one of the better kept secrets, but this country is in a pandemic. This pandemic has created uncertainty at the national level, uncertainty at the state level, uncertainty at the county level, uncertainty at the school level, and especially here in Palm Beach County. Now, let me be clear, I'm not happy about what I see and hear. I don't think schools are ready to open, and I seldom have a lot of confidence in how decisions are made by this board and your staff. Things are bad. I mean, really bad. However, I am clear on two things. That the decisions that this board make could mean life and death for some. And I'm also clear that as bad as things are, if you fire the superintendent, you would make them just that, you would make things just worse. I'm not even clear on how you could even consider firing the superintendent days before school opened. Remember, we're in a pandemic. Can you imagine the panic that this is creating in our communities? Do you even understand, intentionally or unintentionally, you are playing into the hands of those who look to dismantle public education? Who do you think will come now if you fire the superintendent to take this district and lead it? Everyone, please chill and place your political agendas aside just long enough for us to find a way to resolve these issues. Dr. Fenoy, get it together. You didn't create this mess. We're depending on you to lead us out of this mess. The Black community stood with you when you were hired, and we stand with you today. But lead, sir. Please lead. I'm just saying.
Okay, board members, policy 1.03 provides that when we have non-agenda speakers, we take them for half an hour and then we can stop them and move them to the end. So I propose that we go 30 minutes with non-agenda speakers at this point, and when we get to that 30-minute cutoff, we take all the rest of those recorded ones and put them at the end of the meeting, where we're allowed to do typically when we go from 7 to 7:30, so we can get through the business of, they're all recorded, so we'll take the live ones and give them the opportunity, but we'll take, that way we can get through the business, and if the superintendent has some of his staff here that need to get out of here, they can move out afterwards. So unless there's any objection, I'll call the non-agenda speakers, and I note the time is 7:26, so that it, and I'll watch the clock when Ms. Pride starts speaking, and then 30 minutes later, we'll stop the non-agenda speakers. Edith Pride, would you please come up to the podium, and after that, Tippy Breakwell, and after that, Jennifer Reed.
Can I take mine off? Everybody else took theirs off. My mask, Miss Frank Barbieri, may I take my mask off, please?
Yes, ma'am.
Thank you so much, because everybody took theirs off, and I want mine off, because it'll fog up my glasses. Okay. So, Dr. Robinson, my name is Edith Pride, Boca Raton Elementary. I listened to you, and you know, gone girl, you was good. But I'm going to do what you said. So, y'all know I have my pages all typed up big to read. And I won't read the first 4 pages, but I will, because I can do it in my 3 minutes. But I will start on my last 2 pages. Dr. Fenoy, you know, I haven't had a problem with you, because I'll tell it to you in this meeting or in front of your face. However, yesterday I heard that message, and I was mad. I heard it, and I had had enough. You took this job as superintendent of a major county. That means all fiascos stop with you. Sometimes you and your people, but at all times with you, period. How dare you bark at teachers like we are wild, crazy children raised in woods by wolves. Teachers, this teacher did not tell any principal to change their master schedule. And principals have always run their schools. But no school can run without a teacher. And we wish you had confidence in us, because you didn't say that yesterday. You were just on a roll. Teachers have never lost sight of the students along any way. That's the district. Let us not confuse the two. Your tone was harsh, snappy, and some of the things that you said anger myself and other teachers. I am requesting, Dr. Fenoy, that you take that same tone and that snappiness and send a message to the parents. These are some of the suggestions, statements, and directions you can feel free to use to give the parents of virtual students. Number 1, please, parents, wake your children up early enough to feed them and get them dressed for school. Also, make sure your child has the book, pencil, and paper when they sit in front of the computers. No laying down in the bed. Number 2, parents, please make sure that you have on proper clothing when you're walking in front or behind the child's computer, because we done seen them in their drawers, the bra, and everything else. All right, remember, all children are on the computers and can hear your conversations. So please try to use proper language. No cussing, because if I say just no profanity, they may not know what profanity is. So no cussing, they know what that is. Number 4, parents, when you're helping your children at the computer, please do not appear with big joints in your hands and cigarettes. The joint be big as a cigar. Oh yes, we done seen it all. Please have that in your hand and in your mouth. Number 5, parents, please understand that your child is in class, and the parents should not stay in the picture and make silly face behind the child's face. Just the parent. While you trying to teach in your class, that's what you need to tell these parents what to do. Remember, all children are on the computer, and they can. Oh, that's the wait. Parents, please understand your child is in class, and parents should not to stay out the picture. Wait, let me finish my last one. Okay.
Go ahead.
Okay. Parents, let your children know that make sure the children return to the class after fine arts and lunch, because they don't come back. And so how do you count that? Is that a whole day of present after what? Parents, the school day starts at 8 o'clock and it ends at 2. Not 8:15, not 9:30, not 10 o'clock while the child is in his pajamas and then he's trying to eat cereal and can't pay attention. Also, make sure the children have on underclothes, because we've had them show up. The little girls got their nightgowns on, put their knees in the chair, no panties, and the boys just walk around in panties. Please make them, these are the things you need to tell them, and put some clothes on. Remember, teachers, y'all can't pay us what we have earned. No, wait, it's been so long since I said it, but wait, give me a minute. Pay teachers what we have earned, because y'all can't pay us what we are worth. Remember that when it's time to get the money right, okay? Okay? You heard what I said. But now, one day it's going to come when we can talk about the rest of this, all right, Dr. Roberts? Okay?
Thank you, Edith. You're always a breath of fresh air. Tippy Breakwell, Jennifer Reed. Please state your name for the record.
Hi, my name is Tippy Breakwell. Can you hear me?
Go ahead, try again.
My name's Tippy Breakwell. Good evening, Mr. Chairman, board members, superintendent, and all others in attendance. I come before you tonight as an alumni, a parent of a current student, and a member of our community. First, I want to thank you all for all that you're doing at this crazy, crazy time. But COVID is not our only crisis. I came to speak to you tonight to urge you to mandate early and immediate ESOL instruction for all speakers of Ebonics in the school district of Palm Beach County. I understand the sensitivity and controversy surrounding this terminology and ideology, but to continue that focus is to perpetuate a lack of intervention critical for education achievement. I was informed on the subject of the language of Ebonics, defined for me as a viable language used by intelligent people for the same cultural reasons as any other, when I attended Dr. Robinson's reading committee meetings for Black student achievement. I was also exposed to the data on our Black boys and girls. I will never be the same. I don't think I have to inform you all that it very obviously shows that we are utterly failing this demographic, or that this failure leads to further disparities in our shared culture and other systems. To continue to deny our Black American students need for the same language training provided to all other students who are speakers of other languages is to continue to deny them anything that resembles equity in our educational system. The ESOL instruction is already effectively in place in 100% of our school sites, and inclusion could be swift. Thank you all for your immediate attention to this very pressing matter.
Thank you, ma'am. Jennifer Reed. Charmaine Postal.
Shameless plug before I get started. With everything that is going on, I understand the district has not been able to focus on urging parents to complete the 2020 census. However, it's important for me to make mention of it as time is running out, 16 days left. Census completion is critical. The success of our schools depend on resources. The adequacy of resources depend on funds awarded. The funds awarded depends on our census count. Complete your census today, 2020census.gov, or call 844-330-2020. Good evening, School Board Chair, Dr. Fenoy, Superman and Superwoman, and everyone in your respective places. Charmaine Postal, speaking as a parent and a product of the School District of Palm Beach County. Indulge me for a few, but first, Dr. Robinson, you are correct. We all share the blame. Schools were overcrowded before the pandemic. Schools needed updated technology, had attendance issues, children needed one-on-one, bus driver assistance, and cafeteria assistance before the pandemic. The lower 5% and top 5% was getting most of the attention, and grabbing the students in the middle was an issue before the pandemic. Funding education, parents' engagement, involvement, and volunteerism tremendously declined before the pandemic. Teachers had legitimate concerns. Student safety has been an issue. Politics played a big role in Palm Beach County education. Disparities existed in the schools. Equity is and have been an issue long before the pandemic. Communication has been an issue before the pandemic. Pointing fingers and blaming others was an issue well before the pandemic. I stand here against the CTA recommendation to terminate Dr. Fenoy. Working together to find a common goal has always been an issue before the pandemic. How many letters have been sent to DeVos, Cochran, DeSantis, way before the pandemic? How is terminating a superintendent in the middle of a pandemic 2 days before school is to get started the answer? There's gotta be a better way. School board leaders, you were elected. Dr. Fenoy appointed. And each of you accepted the responsibility to serve every child and every community in this district. Be very cautious of those pointing fingers and further dividing the district when unity is what we need more than ever. We are where we are, and the only way we can move forward from here is being unified. As a frustrated parent, I will take moving forward with the mission. The mission, the School District of Palm Beach County is committed to providing a world-class education with excellence and equity to empower each student to reach his or her highest potential with the most effective staff to foster the knowledge, skills, and ethics required for responsible citizenship and productive careers. School board members, who am I and all the previous speakers to call an action or demand something of you? We are each one person with one opinion. Let me remind you, you can't make everyone happy, but you have to follow the mission. And Dr. Fenoy and board members, remember, the district is not equitable enough to please everybody's demand and complaints. Thank you.
Thank you. Is Jennifer Reed here? How about David Ray?
Good evening, members of the board. I appreciate you guys, and I want to begin by saying my name is David Ray. Everybody calls me D, so I'd love you guys to do the same. I love everything I've been hearing tonight about the concern for students, and I'm here to echo just something that I've been hearing from some parents because I've been working in some food drives locally and around the county. Specifically, I'm here on behalf of some parents that I spoke to in District 6 at Rosenwald Elementary. But as I dive into this issue, I find that this is an issue in all of the Glade schools. Sugarcane burning is a perfect example of environmental racism. And as we start looking at the things that affect our community, especially the Black community, we should start looking at some of the things like this. Rosenwald was designed to keep students inside longer periods of the day so the burns could go on in the field. There's no doubt in the science, especially after what Harvard just released in their recent studies, that fine particulate matter, which is a byproduct of said burning, is a problem for young lungs and old ones. This exasperates what you experience with COVID and exposes you to a higher death rate. That being said, this is a liability for the school board, and I think everybody with a heart should care about this. Teachers have quit and students have been hospitalized. It's hard to find good it's hard to find good teachers, which we all already know, but even more so, it's hard to build that trust with parents after their children have been in the hospital because of negligence on the part of the board. So, following the CDC guidelines of advising that no burns go on, especially during the times of COVID, I am asking the board, as you go into this COVID talk and you relate to all these people on the health advisory boards, look into the effect of this. Put some pressure on Nikki Fried, which is the commissioner in charge of this, and U.S. Sugar. You all are leasing land to them. And so how it relates to you, in my understanding, because I looked at the lease and the best I could, I tried to get what I could for you, but I quote that U.S. Sugar shall not commit any hazardous acts on the property nor use property in any manner that will increase the school board's exposure to liability. At the request of the school board, U.S. Sugar shall, at its own cost and expense, comply with any and all requirements of the school board's risk management department. Now, you all do not have responsibility or ties with all the burning that goes on, but there are more and more green harvesting programs right now in the Glades than ever before. If Walmart had enough teeth in Clewiston to make sure that there were no burns that were going to affect their store's revenue, the school board has enough teeth and support to make sure the same thing happens for their students. Now, I know that the lease might not be up for another couple of years, but the $12,000 that you all get from them, I think is enough of incentive to say, hey, you're putting us at risk. Because should a student die, and should that parent get the support they need, not only will they sue U.S. Sugar, but they can sue you guys. Now, that's not a threat. I'm just saying it's something that I see as a possibility of bringing more equity to the black communities in District 6. We have to put some pressure in stopping that, because as we move into this post-COVID world, that is something that we should take into account. The burns got to stop. Appreciate you all. Thank you.
Thank you, Mr. Ray. I'm not sure the last name here, but I think his name is Robbie Littles. Are you here? If not, Michael Cleveland, possibly. I can't read the last name either. Mr. Little's here.
Robbie Littles, representing the bridge builders of Palm Beach County. Good evening, members of the board, superintendent, Dr. Fenoy, and staff. I am here to speak against any and all efforts to remove Dr. Fenoy from the superintendent's position. Clearly, these are critical times, requiring clear, analytical, and critical thinking before taking any action toward firing Dr. Fenoy. Hopefully, Dr. Fenoy shall quickly correct the administrative breakdown or factors causing parents, students, teachers, and staff to suffer severe consternation. Simultaneously, I hope the board shall use this time to familiarize or re-familiarize yourselves with the legal parameters you are to operate within, specifically as it relates to how the superintendent assigns and reassigns personnel from the top to the bottom. We think he knows better than each of you individually and all of you collectively who can best make things happen in this school district and get things done. The courts have told this school board before that the superintendent makes operational decisions in Palm Beach County, not the school board. Remember Dr. Joseph Carroll, who decided who he would appoint as a principal, and the board thought they rebuffed him twice, and he took the school board to court, and the court said, you hire the superintendent, and from that day on, every employee in the district works for the superintendent, not you. Please be advised. Someone early on mentioned teachers needing better pay. I concur. And I would ask that each of you critically, analytically, think about and have the courage to step forth and say and demand that in Palm Beach County, the starting salary as quickly as possible for all teachers be $65,000 per year, and that all veteran long-term teachers get adjustments as appropriate. That's what critical analytical thinking can produce for this school district. Thank you very much.
Thank you, Mr. Littles. Michael Cleveland, are you here? Sir, please state your name for the record in case I mispronounced it.
Good evening, Michael Cleveland.
Okay, I did it
West
right.
Palm Beach. I too am a member of Bridge Builders, but I also am a native of West Palm. I have some very important thoughts on these proceedings as it relates to the dismissal of our superintendent, Dr. Benoit. Clearly, mistakes are made all the time. There's nobody perfect. These high-level positions are positions that no one can just jump into and make critical decisions instantly without some type of criticism. Clearly, no one has a clear plan on anything about children, teachers, and staff in the schools. I am really surprised that the district even opened the school as soon as they planned to. Personally, I thought you would wait until the first of the year. After all, COVID is alive. Make no mistake about it. You've been all told it's a life and death situation. It's surprisingly, instead of being here speaking of education and educating our kids, we're here speaking of life and death in the schools that will affect the teachers and the kids. Why do you want to go open the schools so early? Pressure. We all seem to be under that political pressure and don't think on our own about things that are necessary for ourselves and the community. It's a game of Russian roulette, if you will. We take a chance. If something happens, who takes the blame? There's the fall guy on everything. Somebody has to take the blame. Unfortunately, these blames are considered life. The healthcare people were here earlier and they spoke of the virus, and it's not going anywhere. Believe that. It's not going anywhere. The man is doing the best he can, I believe. I understand he can do better. We all can do better. We all should do better. One day, hopefully, that day will come. The kids can return back to school safely. Dr. Benoit has come up with the plan you expect them to. But I also thought that, and I'm sure you don't agree with this, but as a governing body, you should have got together with the superintendent in a meeting. Give your suggestions and thoughts together so when you came before this body, there would be no question of what is needed and necessary for the safety and well-being of the students and the teachers in our schools. I thank you.
Thank you. Kavon, would you play the first 4 recorded messages from our non-agenda speakers? And before you start that, I just want to thank Mary Luz Victorias, Maria Rodriguez, and Ermin Jacquet. These are the three ladies who have been cleaning our podiums all night, so thank you for being here. We appreciate it.
You're welcome. Thanks.
Yes, good evening, school board member and superintendent. My name is Carl Muhammad. I'm a non-agenda speaker, and I'm calling as it relates to the idea of the covert pandemic, but I wanted to refresh those inside of the school district as it relates to the pandemic and the epidemic that's been going on constantly in the African American community. I know that we've matured at some level to the idea of looking at the word equity, and it still doesn't seem that we have that ability in order to do such. You know, when a person has no knowledge of themselves, then they can't value his or her self with the education that we've been rendered. I mean, dealing with the system that has produced generations of miseducated black people here in Palm Beach County, as we continue as a community to try to get our footsteps in the sands of time, we're still asking those of you who have the responsibility to assist us if you would consider in doing so. Now, my community really appreciate the $100 to $200 donations that we've been receiving over the years, but we know as an educated group of people that there are some real resources that are needed. None of this 100 and 200, there are thousands and millions of dollars that need to be invested, like was invested in order to give us the formal education that we have that don't render us with kind of any ability to assist ourselves. We're trying to set up libraries in our homes, but we have to have these libraries set up by those inside of our community that have the knowledge of what actually is needed inside of our community. I just wanted to drop a few things that I've personally been a part of. I'm one of the original board members of the Coalition for Black Student Achievement. I'm one of the people that were on the original Achievement Matters for All writing team, part of the Superintendent Task Force, former chairperson and director of Black Youth Enrichment Association, and the former mayor of West Palm Beach African and African American Advisory Board, and the former education chairperson for the NAACP. And I wanted to say that I've never, as of yet, in the past 20, 25 years, seen anyone that come with a real substantive investment to assist us in any kind of meaningful way. And I'm asking at this very critical time, as we continue to try to reconstruct some of the educational experiences for children, I'm asking you to take another look and utilize the thought process that many of you have had training in, and to really realize the fact that we need some real resources to do some things in our community on our own. Thank you for your time, and should it be
This is in regards to the special meeting, multiple agenda item numbers. Good afternoon. My name is Amy McCarroll. I have 3 children, 2 of which are in the public school system. My oldest is gifted in all advanced classes in 6th grade, and my middle child, who is also gifted but has a processing disorder, that this child causes this child to have an IEP. With my background stated, I wanted to address some major concerns I have. I would first like to know when my choice has to be made. Since the email says Tuesday, September 9th, Tuesday is the 8th, and Wednesday is the 9th. Second, how am I or anyone else supposed to make this decision, as we and the schools don't even know what or how they will go back? The document sent, as I understand, will have policies you said, but each school principal has to make the plan, and until I see this plan, I cannot and will not choose. Third, I have excuse me, I have no problem with my children wearing a mask and to and from class or walking around on campus. However, I have a huge problem with them breathing carbon dioxide for 8+ hours, which could severely alter their brain, as my father died from this very issue, not getting enough oxygen and breathing in his own carbon. I would like you to please consider them taking off masks while seated in class. Another issue with the mask is my middle child is a chewer, meaning he chews his shirt, blankets, anything really. It's a nervous tick. So what am I and his teachers to do with the mask that will inevitably get wet and gross with the spit? That's not very sanitary or healthy for anyone. Now on to my fourth and final concern. I'm under the impression that kids will have to be using Chromebooks in class, exactly the same as they are at home. First, my child will not be bringing their personal Chromebooks to school, and I will not be taking possession of a school-issued one to come home. So will they be provided at the school to stay at school? Second, my middle child is having the hardest time moving between tabs, even though the teacher is admitting this child cannot do it on the processing delays is hindering this child learning this way. And if this is how class will be, might as well pull the child now and do third grade again next year. This child spends more time trying to figure out where to be than learning. I look forward to hearing the responses from each of you, as I will be sending this in email form to the entire board as well. Thank you.
Hello, I am Sheila Calderon, Green Acres, Florida, and I am calling concerning a non-agenda item, and that is concerning the school board's hopefully influence on the sugar industry to stop the sugar burning. It is with deep concern that I'm writing to you today, or speaking to you today, concerning the toxic pollution from sugar cane burning that is inflicted on the children in the Glades area and beyond. The sugar burning season will soon begin and last up to 6 months and more. I visited the neighborhoods in the area over a year ago and was absolutely appalled that there was sugar burned right up to the school fences. I spoke with residents and heard how their family's health was being affected, many with asthma, cancer, and other lung diseases. I am truly appalled that the school district board has not taken action to stop this pollution affecting so many of the children attending school there. There's a report called Grist's report about the sugar cane. I suggested in my letter that I wrote to you as well to make it clear that to read that. It makes it clear that the school district is content to put their financial relationship with the sugar industry ahead of the health and welfare of the students and staff. Very sad. It's beyond my comprehension that you can approve schools being reopened under these conditions, especially during the COVID-19 pandemic that we are all suffering through. It is time that steps are taken to force the industry to go to green harvesting. The incentives that the industry is getting must be withheld until such time and the industry leaders stop this pollution. I believe the school board can put the pressure on our legislators to take these steps so that they choose to make a difference. I'm concerned about the school district possibly having a financial relationship with the sugar industry and putting that ahead of the health and welfare of the students and staff. Are any of you willing to put your children in schools where their well-being are put at risk? I'm asking that you take whatever steps necessary to protect the children and families at this time of the pandemic and climate change that are exposed to this pollution for more than half the year. And I thank you for your attention and look forward to your support of my concerns. Thank you.
Hello, I have a non-agenda item. My name is Ida Perry Foster. I am an RN with over 30 years of practice in labor and delivery and newborn intensive care. I have a comment I would like to make. Our prenatal mothers receive special vitamins and procedures to provide the best possible outcomes for our babies. The health of toddlers and preschool children is also prescribed with vaccines and best practice pediatric care. It is understood, therefore, that the Palm Beach schools would continue to monitor the health of school children and intervene in the case of a significant danger to the health and well-being of these school children in Palm Beach schools. I was beyond shocked to attend a community meeting in Belgrade and observe the toxic smoke and black ash near the schools. After talking to the mothers in this area, I was made to understand there is a high rate of asthma with the children in the community, which continues into adulthood. What is at stake is the very health of an entire community that is helpless in the face of inaction from those in position of authority, such as the Palm Beach County School Board. What is the purpose of the school board if not to protect the children from the suffocating pollution caused by the harvest? What is very puzzling to me is that there is another widely practiced method of sugarcane harvesting that completely eliminates burning that is not being used. Therefore, the harvesting season using this method would not bring about the poisoning of residents in and around the Everglades agricultural area. Let us end this widespread danger to this community that has truly suffered for too long. It starts with the school board speaking up and ends with modern methods of harvesting that are better for the community, the schools, the school staff, the growers, and the environment. Thank you.
Board members, that was the half an hour of the non-agenda speakers, and pursuant to policy 1.03, we'll take the rest of them after we finish the agenda. So that takes us to the agenda. The consent agenda. Do any board members wish to pull anything from consent? Seeing none, we need a motion to approve the consent agenda. Motion by Ms. Brill, second by Mrs. Whitfield. Any discussion? All in favor? All opposed? Motion carries 7-0. Takes us to new business. The first one is a BRD item that's one of ours. I recommend the board accept and approve the general counsel's evaluation. Motion by Dr. Robinson, second by Mrs. Andrews. Does anybody want to discuss anything else about Mrs. Rico while she's sitting here? Okay, I see. I thought Mrs. Andrews was moving her microphone toward that. All right, I think I took the vote. Did I take the vote? I don't remember. All in favor? Opposed? Motion carries 7-0. Congratulations, Mrs. Rico. On your way out, you can take an excellent evaluation with you to Italy. The superintendent had to take an important phone call, so he'll be back in a minute so we can go to COM1. You know what, Mrs. Andrews, why don't you go ahead and read the proclamation? We'll have him make the recommendation afterwards.
Thank you, Mr. Barbieri. Proclamation, Hispanic Heritage Month, September 15th through October 15th, 2020. Whereas Hispanic Heritage Month begins on September 15th to celebrate the anniversary of when Nicaragua, Honduras, Costa Rica, El Salvador, Guatemala became independent countries, which are now called Central America. And whereas Hispanic Heritage Month celebrates the rich culture and historic traditions of Hispanic Americans whose roots go back to Mexico, Spain, the Spanish-speaking nations of South America, Central America, and the Caribbean. And whereas Hispanic Heritage Month highlights the achievements and contributions made by Hispanics and Latinos. And whereas it is vital that the representation of Latino cultures and the history of are infused into the curriculum to foster the academic success of students. And whereas the School District of Palm Beach County supports improvement of academic achievement for all students and ensures adherence to Florida Statute 1003.42p, the study of Hispanic contributions to the United States. Now therefore be it resolved that the Superintendent and School Board of Palm Beach County do hereby proclaim September 15th through October 15th, 2020 as Hispanic Heritage Month. done the 16th day of September 2020 in West Palm Beach, Florida. Signed by Frank Barbieri, Board Chair, Dr. Donald Fenoy, Superintendent.
Thank you, Mrs. Andrews. Dr. Fenoy, would you read COM1?
Yes, sir. COM1, Hispanic Heritage Month Proclamation. I recommend the board proclaim September 15th through October 15th, 2020 as Hispanic Heritage Month.
Motion by Dr. Robinson, second by Vice Chairman Shaw. Any discussion? All in favor? Opposed? Motion carries 7-0. P2, Mr. Superintendent.
Yes, sir, Mr. Chairman. P2, I recommend the board approve the personnel addendum as submitted.
Motion by Mr. Shaw, seconded by Mrs. Andrews. Any discussion? All in favor? Opposed? Motion carries 7-0. And one thing that I didn't do earlier because of the time constraints, I did not read the memoriam, so I'll do that now. Margaret Cantrell, teacher, Elementary 3, Lincoln Elementary School. She was born in 1948 and passed away in August of 2020. Louis Lasso, custodial 4-person 5 at West Boca Raton High School. Born June 5th, 1962, passed away August 11, 2020. Diane McCory, teacher, Elementary 1, Barton Elementary. She was born September 17th, 1957. She passed away March 20th, 2020. And Joseph Simmons, a technician, mechanical senior maintenance and plant operations, born August 11, 1960, passed away July 26, 2020. If we could take a moment to remember these employees and their families. Thank you, everyone. It'll take us to board discussion items. The first one I put on is BD1. Mr. Superintendent, I would just like to get clarification. I know the board did a lot of stuff last week on the policy, but I just want to get clarification on one thing. My understanding was we weren't going to put the principals in the middle. I know they ultimately have to make the decision whether or not they have any spaces available for teachers to work remotely. But, you know, I believe at some point we were told there was going to be a panel or a committee that was comprised of district staff and the regional instructional superintendents who would then consult with the principal, find out if, you know, if there was 3 applicants, can you handle these or not? And the principal would say yes in conjunction with the instructional that would look at the, you know, look at the master board and determine whether or not there was any way to accommodate those teachers. And if yes, the panel would notify the teacher that you've been that you have been approved, or no, you know, the panel is reviewed the situation at that school and there's no position. Now, maybe I misunderstood that, but I thought that that's what, Dr. LaCava, I thought that's what you guys explained to us. And if that changed, I get it, but is there a panel, and are they doing that so that because one of the situations, when I visited the schools, the principals say, you know, we're going to try and do what we can to make sure that we don't disrupt everything going on here with the master board, but it's tough for principals to keep a relationship with the teachers in the school if they're saying, no, I can't do this. That's why I thought we centralized it, and I believe a couple board members even indicated that they didn't want the principals to be like the person that has to deliver bad news if there's bad news. I mean, is there any way to fix that? And one of the other questions I have is, one of the principals said, Frank, I got 2 spaces available, and I've got a priority 2 and a priority 5. I can make both of those work, but if tomorrow I get another priority 2, what do I do with the priority 5? Do I call that one up and say, we changed our mind? So shouldn't there be some kind of deadline so that, I understand for ADA we can't have a deadline, we have to let people apply when they need those kind of accommodations, but can't we have a deadline so the principals know this is it? Now I know who's applied and I know which priority they are, and I can figure out how many I can accommodate, if any. I mean, it seems to me that would have been a little simpler way to make this work.
Yeah, so I had a couple of board members talk to me about this, and so you're right. So originally at that meeting, we talked about forming a committee. Now, again, we were talking about this in real time, so it was like an idea that then, oh yeah, that sounds good, and blah, blah, blah. So once we got back, we heard directly from the regional instructional superintendents that they did not want to participate in that. because they needed to go get the schools ready. And so at that time, Dr. LaCavin said, okay, then what we'll do is we'll bring all of HR together and we'll own that process. So I think now, to your point, so I think we've done a decent job of trying to keep, the bad news away from principals, but this seems like this last piece. I think we can look at it some more and see if we can get closer to maybe if we call the principal and ask and say, okay, what's available? Then we can maybe deliver the bad news, but I think we still need to. I think it's applicable. We can get there, and I think just give me a couple of days to figure this out. To Dr. LaCava, if you and your team could look at this a little further, and we'll discuss it at Executive Cabinet to see what more we can take off the principal's plate as it relates to this.
Okay. Mrs. Andrews?
Yes, I'd like to add to that because I think we're having some real difficulty with the people that we are denying. I think this is going to impact our opening day for school. We may have a tremendous amount of substitutes. People are suffering. You just heard the speaker just a few minutes ago. I'm getting a lot of calls from people. I think they're left out there. They've been told that they've been denied. And, they were approved by maybe your committee. I don't know who sits on your committee. Is it just Human Resources? Is that what your committee consists of, your team?
Mark, would you turn on Dr. LaCava's microphone?
Yes. When we decided to remove the responsibility from the principal and the regional superintendent, we decided just to have human resources professionals in that committee. And they're reviewing medical documentation and they're reviewing the application. But yes, those are the only people that are involved in the eligibility process.
Dr. LaCava, can you speak to the person that you found on your team who actually is a medical doctor?
Sure. So within the human resource professionals, we do have an individual that has a background in reviewing medical documentation. So she has been able to look at these a little bit better, a little bit more deeply when we have questions. So most of our eligibility applicants are getting approved. The only time they are getting denied is if there's missing or if there's something missing like a medical doctor, and we're asking them to go back and bring it back to us. Now, what happens from the time they receive the eligibility, they go to the school, like Mr. Barbieri was reflecting, is do they have a remote work opportunity at that school? So
let me clarify something. There's a semantic issue here. HR is doing a screening. They're not denying or approving what happens at the school. Mm-hmm. So what they're doing is looking at the documentation to say that you are eligible based on these metrics. So the denial of the so-called denial of distance learning is because there isn't anything available, not because they weren't qualified under the rules established by that team. And so that is the tension, is that, as I allowed something like this to happen, we knew as soon as we started, you would have a bunch of people that I have pre-diabetes and high blood pressure. So then I technically can work from home. I'm qualified. So I think that was the reality. We opened the pool so much. So now we have these people who do qualify under CDC or whatever those rules are, but it doesn't align with the number of available teaching positions that the schools are able to create. And so I think we need to keep working on seeing how we can match that up. I think I heard an idea that maybe, Dr. LaCava, part of that appeal process was to create this pool that then we can then go from there as more and more opportunities present themselves or go away. I think that's the part I think even I heard a couple of people say, as the kids keep coming back, then some people who may be approved will say, well, now you have to come back because we now have this. And so I think we must do a better job explaining all of this thoroughly, and that is the task of the action plan that HR is going to be putting together starting already.
Can I answer Mr. Barbieri's question that was not answered, the one about the priority 2 and the priority 5? Yep.
Yes, sir.
So right now we're only approving priority 2s right now. Well, let me make sure I explain that correctly. All the applications are coming into us, and we're reviewing them. At this moment, we're working with the principals on priority 2s, and they're date and time stamped. So the only thing principals are seeing right now are priority 2s.
Did that change? Because when I was at the schools over the last couple of days, I had principals saying they had priority 2s, 3s. One school had 40 that were sent to them, all subject to, I guess, conditional approval or whatever we're calling that. And there was 2s, 3s, 4s, and 5s mixed in.
So the first 933 applications that were sent out by the system, because we were coding everything through our dashboard, were sent out. Then it was reclarified that only priority 2s that we are working with. So after Saturday evening, the only thing principals are seeing are priority 2s. And we've continually reminded the principals. We even sent an email today letting them know that only work with priority 2s until further notice.
Okay. Mrs. Andrews?
Yeah, I just think we've left these people behind a little bit. I know maybe there's not a position at a particular school. You're trying to work on a pool so that you can be able to help them. But the people need to get the information as to what's going on with them. I'm getting the calls from people saying, well, we don't know who's on the committee. They're feeling elated that they've been selected by you, but it doesn't mean anything because when they get to the school, they've been cast out. We need to know, you need to know who these people are. Somebody needs to get in touch with them and tell them. Maybe there's going to be a possibility for them. Maybe they can use some of their sick time because something will open up. I do believe we're going to have a lot of vacancies. A lot of people will be home in distress next week because nobody has reached out to them. And I don't know how you're doing to reach out. The principals are trying to open their schools up. They don't have time to counsel with or explain to somebody that even though there's nothing for you now, there may be something for you in the within the next few weeks if you can hold on. Maybe you do have some days you can take. Now, this is not just for teachers. This is for non-instructional people, too, because they're out there and they're calling to say that no one's explaining the process to them. And it still goes back to communications again. So I don't know, how are you going to make sure these people understand what's going on?
Yeah. So, after last week when we received the additional options and now we have the additional people applying, one of the things that we did is that we made sure that we had a robust communication process. You know what I mean? So in regards to looking at Ask HR, the Human Resources Customer Care Center, we have multiple emails that are just addressing those issues as well. And then when they come to the appeal process, I'm dealing with those directly as well. So we have various methods of communication. We are dealing with a lot of applicants, and but there's no excuse. We are trying to continue to look at what other ways we can continue to communicate. But the process is out on our website as well. And also when they receive their letter of eligibility, it tells them exactly to go back to the school and also, where to appeal as well. So we'll continue to review all those and we'll continue to expand on our communication process.
And the last thing, Mr. Barbieri, I do want a robust teacher, a certified teacher in the classroom. I hope that the school district on next week won't be filled with subs because we've denied these people the opportunity. So I don't know how we kind of put that together because my phone is just beeping off from teachers calling me saying, what are you going to do, Ms. Andrews, at the meeting tonight to let people know that we're still out here. Principals do care about them, but they may not be able to work it into their schedule. And Dr. Fenoy, I just think, just like you're saying, something has to be done to catch these people. There needs to be some kind of catch-all so that they'll know what to do and how to do it. And many of them have sickness. They have underlying health issues, and maybe they can't get in right now. But we don't need to leave them home suffering next week because we haven't explained to them what the process is and how we truly want to help them, because they've been valued teachers for us for many years, probably.
Okay. Yes, ma'am. We'll look into all of that.
No problem.
Ms. Brill?
Thank you. And to the superintendent, I know we had one speaker who said she was approved. I've been hearing from some teachers, and I've spoken to some principals. They've all told me, yes, they're going to work their best and see if there are opportunities. And I truly believe that. But I do have a few teachers who have said to me, no one is getting distance learning opportunities who are teachers. And I just want to dispel that rumor.
That is not a true statement.
Well, I just wanted to go on record because, I've only heard it from certain areas, and I've said, no, go back and speak to your principal, but I appreciate your clarification.
Mrs. Whitfield?
Thank you. I was going to say one of the things I saw today when I was visiting Coniston was the places where the teachers who had been approved for distance teaching were going to be teaching too, where the students in person would be sitting. So I know it is happening. A few minutes ago, when Dr. Robinson was giving her update, she mentioned the pods, and I had just a question about it, which I emailed to the group. And then Mrs. Rico asked that I bring it up as a point of personal privilege, just to get a little more clarification from Dr. Robinson about pods. And so I felt like this kind of fit into this discussion a little bit more, if that's okay.
Sure, go ahead.
Thank you. So the pods, actually that term, and I mentioned it in a previous school board meeting, is a model that, gosh, I don't remember which country it was now, but it came from what was done in another country and how well it worked, where they basically had, I think they had 10 students per classroom and the teacher, and they just did not interact with anybody, right? And so there wasn't any crossing in the halls, and there wasn't any going to the cafeteria, and it was, and I get that it's much easier in elementary school, but that's the concept, is like you just minimize the interaction with other people at school, and then and it would also help with contact tracing, and it would also help if we had to consider closing down a classroom. It would be like the classroom. We would not need to worry about what other children they came in contact with on campus because they lived in their pod, right? So that's what that is. So, can I?
Good.
Did you want to? Okay, so let me just say, so I realize this very late in this, but I think that we just kind of need to change this MO. So the first thing is I don't remember seeing, and I'm gonna clarify that because I've got like 1,000 emails I haven't caught up with, but I have not seen that chart that I keep asking for that says at this school how many students we can hold 6 feet apart, how many students, I hate to even say this, but how many we could hold if it was 3 feet apart, how many teachers said they're coming back, how many said they want to do remote, how many children said they're coming back, how many, and so forth, right? 'Cause if I could see those numbers, I think I might have a better idea of the issues, but I still kind of think we need to scratch this whole simultaneous teaching thing. So, and I've been back and forth with this. So now I actually last week talked myself out of this position, but I'm back in this position. So I get that the way I think we should do it, where we just say, okay, are you teaching face-to-face or are you teaching remotely? If you're teaching remotely, maybe the district assigns you. Maybe if I'm a 4th grade teacher and I'm teaching remotely, I might not teach just the students in my assigned school. It would be, you'd make the numbers work and populate the class, but then I understand some of the problems that creates. That would create a problem, for example, if the child was in a dual language program, they might not have a teacher who's bilingual. So it essentially would disrupt that academic program. The other thing was mentioned is, as the numbers go down and people decide to start sending their children back to brick and mortar, then that would decrease the number of teachers needed for remote, and we'd have to start saying to teachers, in a prioritized way, which we're doing the priorities, that you need to go back into brick and mortar, right? And so I get that is disruptive of the educational process, but then I think about it, but we're talking about lives, right? So I just go back to that place. If I'm looking at it in isolation with the educational process, I would say, okay, we had to make that simultaneous teaching work. But one, maybe Ms. Pride can pull that off, but I think you got to be almost a water walker to pull that off, okay? But even more importantly, we are not doing everything I think that we can to meet the needs of our students and our workforce. Like, we are in a crisis, and we should try to make sure we do everything we can so that people are healthy. And so I'm just going to ask that we reconsider that. I get that there's no good solution right? And certainly no perfect solution. But let me just go on, and especially since we're going to be dealing with class size reduction, it seems to me that that factor helps move us away from the simultaneous and just saying, okay, you're remote and you might not teach children that you know from your school, and when baby goes back to brick and mortar, you know, they'll have some adjustment because the teacher might be in a different place in the book or whatever, but they'll be alive, and so will their mama and daddy and their grandmama and granddaddy and their aunts and uncles. Okay, so I'm just asking to reconsider that, because life is more important than academics. I'm just saying. Now, number two, I think we also, somebody said it, we need to have a deadline for when staff can apply and say, I want this, I don't know what the magic words are, I want to be priority 2 or 3, whatever, right? But, and I'm also going to change my position on something else, because I know that I told Dr. Fenoy a long time ago that this, when some other school district published that what they were doing, and they were telling parents they had to decide if their children were going virtual or brick and mortar, and they had to make a commitment for the first semester, I was like, yeah, we're not going to do that, right? This board does not have a political appetite to do this, right? Now, I'm going to ask this board to, okay, I told the superintendent to man up, I'm going to say board man up, okay? We need to look at saying, parents, whatever, choose by whatever, I don't know what the date is, October 5th, and whatever you choose there, we're going to ask you to stay there for first market period, first semester. I don't know the details, but I'm saying I'm ready to say that we've got to do better, but one of the ways we do better, in addition to considering this disruption of this simultaneous teaching, is to say we need people to make commitments so that schools can plan, right? I don't know how people, like, I hate to say the master board, but I don't know how people do the master board with people coming and going and coming and going. Some of that coming and going is going to happen because we're in a pandemic. But let's minimize that, right? And I would say, if we say, parents, effective whatever date, we need you to commit to such a, whichever mode of instruction you want your child in, there's going to be exceptions. I get that, right? We need to try to outline those exceptions, but we need to also ask parents to help us do our best, right? And so I'm just putting all that out there, because I think that right now, in some respects, I think that we have been brought to our knees, and it's time for us to stand up and do better. I'm telling you what my best idea is. You could come up with something better, do something better. But I'm just saying, we have teachers who want to teach, but they want to teach remotely. And I've had people who've said to me, they just don't want to come back to work. Don't even say that, right? That is not right for us to have that kind of attitude. If they're willing to teach remotely, which I actually think is probably harder than teaching face-to-face, we need to connect them to the children, like my grandchildren, who will be learning remotely, right? So we just got to do better. Dr. Fernand, I'm going to just ask you to put it all on the table. Because we got to do better. I hope we don't end up in the same place, but put it all on the table, because...
Yeah, I'm sure the chief academic officer and the deputy superintendent. We all have corrective action plans that have to be developed. But let me give you some early conversations. So these conversations have been had with our regional structures and principals. So one of and Keith, you can chime in on this. One of the things that the principals told me about creating sort of Donald Fenoy as a teacher of record, I'm gonna populate these kids from all places, is the teacher of record may not be able to handle a classroom of kids from Boca High and a bunch of kids from Glade Central. They literally said, Donald, I don't know, you start mixing these communities, like some of these teachers can't deal with that. And so that was one of the first sort of showstoppers for the principals, is that they didn't know you're going to take some, I thought about it, I was like, and naively I would say, well, a teacher is a teacher. And my principals would say that's not true. They choose to be in certain communities and deal with certain realities. So I think that's one factor that the principals told us directly, like, so, but to your point, what you're really saying is push through that. That's what you're saying. I'm saying what? Push through that. Yeah. Push through that. And so I think, but then to your point, as a board, when people start calling, you can't call us and say, move this person for me. You understand? Like, That's the tension. So if we set a way of doing business, then we have to hold to that business throughout the entire process. And we can't create an exception because somebody knows somebody that can make that exception happen. So, but we'll look at it. Agreed?
Yes. Mrs. Andrews?
I still want to know the numbers. You know, people are waiting on appeals out there. I guess they have to use their sick days while they're waiting on an appeal. How many vacancies do we have? How many people have been placed in remote learning? Why can't we get a spreadsheet so that we will know what's going on within the district for particular schools and so on? Because people are saying, I'm waiting on an appeal. School starts Monday. This is what happens when we wait late. And so people are very frustrated. Many of these people probably need some counseling, just like you heard the speaker tonight. They're very upset with us. So we've got to kind of get a better handle. I would like to know as a board, how are we doing? Do we have 200 subs coming in on Monday? What happened with that? Could some of those have been people to work remotely? I really don't know because I've never seen a spreadsheet with the numbers.
Sure. On I believe on Monday or Sunday, I sent every single board member an email with the Power of BI dashboard on it, and there was a step-by-step piece on how to log in. I also put, I believe I gave it to Mrs. Bass, I put a hard copy like it was requested by the board in the board office, a spreadsheet to review those numbers. So I can continue to do that. I'll send you, if you want, the dashboard as well, and I'll show you.
I want that, and I also want to see the vacancies. I don't know if that was on there, all the vacancies, how many subs.
Sure, I send that every week, and I will send it to you personally.
I know where the vacancies are, but I'm saying as it relates to people who are actually applying for remote.
Yep,
and
done.
Putting all those pieces together. We need to see it all in one package.
Well, let's hold up on that because we have a whole other process we're about to go through, which is reducing the workforce because of enrollment. So remember, our enrollment numbers are down, what, Mike, about 5,000, 6,000? So we have to level set, and that's a normal process for us. That's not nothing new. So until we level set based on enrollment, those answers will not be answered. Because, and that's the next phase, which will be, you know, Mike, we've been talking to the executive team, we've delayed it as long as we can. And so the commissioner wants to know those numbers, and then the budget has to be adjusted accordingly.
And I'd just like to follow up, Mr. Barbier, and I do recognize the 11th day count and the enrollment decreased about 5,000 students. But I still want to know that we have teachers here, and maybe some of these teachers will be lost through the process, you know, with the enrollment piece, and you're going to have to do some shifting around. I did human resources. I just want to know where those vacancies are. They may not be vacancies for long, but we need to know that. We need to know how many people applied for remote, particularly for each school, and how it shakes out.
I thought we just said that was in the dashboard, right?
Yes, I sent it to every single board member on Monday evening with directions.
I think you had to lock it into that, so yes.
Remember, the dashboard, Ms. Andrews, is updated every day.
Okay, well, let me see.
So every day you want to see those numbers, just log in and it'll be right there for you.
And you can always give me a call, take you step by step. Everybody in my office knows how to use it, so we're here to help you.
So do teachers know how to use that? Is that something that they
No, we
see?
do not share with teachers. We share with all administrators, all principals, regionals, and we share with the school board so you can kind of see the prioritization, and you can break it down by schools, by district, by non-instructional. It also gives you a number of applicants. It gives you, I think, prioritization of selection. I'm looking at it right now, but I will be more than glad to help you and kind of go through that.
First thing in the morning, because that's a big question people are asking.
Mrs. McQuinn, I get a reflection, so I can't tell if you had your hand up or not. I'm looking through two different sets of glasses. Okay. Okay. Was anybody else on this discussion item? All right.
Mr. Barbier, can I just say something?
Yes, sir.
Julianne, I want to thank you for helping me through these last couple of years. We don't always see eye to eye, but you guys have been great. And I just wish you the best in Italy. And next year I'm going over there, so if you have an extra room, I'll be there. So thank you very much.
You need to make reservations, Dr. LaCava, because I got it first. So. Mrs. Andrews, you have BD2.
And yes, I want to take a few minutes, a point to kind of tell you why I put this on the agenda. And as we all know that we're in a pandemic right now, we're in the pandemic together. And the superintendent is our employee, as we very well know. I've called the general counsel, spoke to her a little bit. I sent you my questions as a board on yesterday, and so you probably know my thought process. And it's interesting, as I listened tonight and even some of last week and maybe the last 2 weeks, we've been in a rush to push out as much as we could at the 11th hour. We can't be there. I know Mr. Tierney is sitting there. I speak to him every week, and what I tell him is we're late. We're running late. I look at a lot of urban districts because I do sit on those calls with large urban districts, and we're behind. We've been behind for weeks and months, but it was nice tonight to see the healthcare district here. It was great to see Mrs. Alonso here a week or so ago. I had been talking about having somebody from the Health Advisory Committee here more often because I knew the health piece is a real big piece. But as a board, we need to step up with our responsibilities with the superintendent, and he must lead. And you heard that a lot tonight from the speakers. And his team has to perform in a timely manner. Many of the things that we're talking about now that we're still trying to work through, and it sounds like we are trying to work through them at these last minutes, these things were done months ago. And I've heard the conversations because I've been on those calls, those Zoom meetings with them. You saw those questions, and we owe it to our students to get the district focused on education and safety, and I think we're on our way there. But we don't need to have an uproar from all of the people that we represent, the students, their parents, the teachers, the principals, everybody, the media. We've really been in turmoil over the last few weeks, and you've heard me say that I believe we lost a lot of our credibility because we really didn't work on the smart end, on the pre-end of it by getting started with these processes early. I know everybody's working, but guess what? It has to be smart work, and we've got to work there. And so one of the things I want to say, I appreciate Justin Katz. It takes a strong person to stand up and actually say that he knows and he sees what has happened. He's been a real good partner with the school district of Palm Beach County when you start talking about union leadership. I've seen a lot of leaders in the union, but I want to tell you, he's a sharp young man, he's honest, and he's respectful. And when he tells us about the things that he has seen over these last few months, they're real folks. I'm the board, so I know they're real because I've been involved with it, trying to see how we can push it, and I think the school board has been trying to push some things. We have to do a better job as a school board, and we have to help Dr. Fenoy. Apparently, he put something here tonight about the kinds of things he wants to do to communicate better. We've got to communicate to the community now. I mean, we really have to because we really lost a lot of credibility. I think we're starting now to get there. But I was looking when I asked Ms. Rico about what to do because I was torn, looking at our leadership and looking at us as a board. How do we fix this so that we can get on a better track? So that's why I put that on there, and I asked I asked the board office to send me the contract for the superintendent. I asked them to send me information about even if we have to look on how we help the superintendent improve. Are there some ideas out there? I didn't say anything about firing anybody, but I think we need to be figuring out how we can help him improve. Apparently, he's been proactive tonight by giving us some information on how he sees himself and how he wants to improve. But as a board, we have to help him. So when I pulled the contract, I saw that we should have been working with his evaluation as of September the 1st. That's a piece we didn't do as a board, and the superintendent has to bring it to us because he has to.
Ms. Andrews, that is not correct.
Okay.
The board voted on December 11, 2019, due to hurricanes, to push my evaluation back to October. Okay. That's why you have not received those documents.
Okay. Well, but I'm looking at the contract that was sent to me. So,
and the board amended that last year in December. You voted on it on that day. It was unanimous.
Mm-hmm. But I say, even looking at your evaluation and your contract, it's something we need to start discussing, Dr.
Oh, no, I don't disagree. We've already started on our end. We've already started working on it. Yeah, but it's not due to you until October.
Yeah, but I'm saying since you see that we're in this situation that we're in, and we've been in it now for the last few weeks, we have to begin the discussion of what we need to do to help you so that you can refocus.
Ms. Brill and then Ms. McQuinn.
Thank you. So I just want to say that first of all, I don't think we've lost credibility, and I think that tonight and the speakers, and the people that we've heard from, we see the support in the community. This is a tough time, and I agree. We have to come together as a board. But I personally, first of all, I will tell you, anytime I've had an issue, I've brought it up to the superintendent. It's been addressed. But again, when we look at doing an evaluation, I prefer to even wait till the end of October. I need the superintendent to be focused on opening the schools and doing what's right for our students and our employees and keeping everybody safe. I don't think this is the time to talk about an evaluation. I think that right now, we have to keep our focus on the prize, and the prize is going to be opening up our schools. I'm not saying push it off indefinitely. Yes, we can address things later, but not in, first of all, as I said in my opening comments, not in the heat of the moment when there's heavy emotions out there, number one. Number two is we've got to see how this all goes. So I really, when we talk about a date and talk about the evaluation, I don't even want to think about it at this time. I'd rather wait at least until October. Me personally, I'd rather wait till December, but that's another story.
Ms. McQuinn?
Well, first of all, if I got one more email out of 1,444 with your evaluation comments, I would implode. Got through Ms. Rico's, right? And that was with Maria reminding me. My personal belief is that these are conversations we should be having one-on-one with the superintendent. That's all I have to say.
Mrs. Whitfield?
Thank you so much. I just wanted to say, since it was brought up by the CTA and it's been discussed in the community, the superintendent still has my full support. This has been the worst time that I have ever seen in this school district, and I worked here for a little bit before as well, and it's unprecedented. And I know we're not trying to play it down or anything like that, but we're doing the best we can with the bad situation. And when I say we, I mean 27,000 employees. Everyone is doing the best that they can right now, and that includes the superintendent. So yeah, let's talk about his evaluation. I would love to put it off past October as well, because I think I don't want him to have to spend any time reporting back to us on things as detailed as those reports he gives right now, when I need him to spend every waking hour, which he is doing, on opening schools and getting our teachers as safe as possible and our students as safe as possible and our families as safe as possible. And I know that's what he's working on right now, and that's my priority for him. And I'm grateful for everything you do. I'm glad you still show up to work, Dr. Fenoy. I really am glad. Thank you.
Mr. Shaw?
Thank you. I agree with what Mrs. McQuinn said, as far as I think it is important that these are conversations that we need to be having individually with the superintendent. And my comments that I made at the beginning of the meeting, I was, I think, very clear on my position on this. This is not the time for us to do anything but show leadership to get schools started. And these outside forces that are pushing us into these kinds of conversations, we need to separate those. We have a contract, we have a process for evaluation, and I have no interest whatsoever in going anywhere in this until the time is set.
Dr. Robinson, then Mrs. Andrews.
Okay, go ahead, Aunt Deborah.
Thank you. So let me just respond. So first off, yeah, it's been worse than this, okay? And as I can't tell you how many times I've said in the past week or so, I've seen this movie before, and I do not want, I want to cut this movie off. And that's why we're having this conversation. So the only thing different here is COVID, right? So, and I don't know who the outside forces are, so I could just tell you, rest assured, Dr. Fenoy, all the drama that I've had going on with you was me, okay? Okay, and I own my stuff, right? I don't know about the outside people, okay? I'm just telling you, okay? I just want you to know, okay? So, so this amendment, which thank you for pointing it out, because I did not have it saved in my handy dandy laptop, says that so the instrument will be presented on October 15th, and by November 15th, we will meet with the superintendent. So that seems to be in alignment with the conversation I've heard here, and as far as I'm concerned, the matter's done. I'm waiting for you to turn this thing around, so.
Mrs. Andrews?
And I want to be clear. I certainly want all of our students to be successful academically. I want them to be at good health. I do realize we have been in a lot of trouble, and I want to be on record saying that lots of this that we're talking about tonight, I've spoken to Dr. Fenoy about. I've spoken to Mr. Tierney about. And I'm really concerned that as a school board, we have to step up and make sure these things happen. We don't need to wait until we have this. I do want schools to open and be successful on Monday. But I just don't want us to be back here with this kind of noise again. It's really clear to me that we are partially responsible. I saw this tonight. I saw the things that were happening because we pushed. But we have to do a better job than that. Yes, it does fall back on us because Dr. Fenoy is our employee. Now, when I asked for the evaluation instruments, this is what I was sent. So I'm reading about what I have that was sent to me based on my request to the board office. No one sent me the additional information that you're reading off of right now. But I stick with this as for what I'm saying. We have to be having open discussions and transparency with our superintendent so that we don't be at this place again.
Ms.
And
Andrews,
I stand
Ms.
firm
Andrews,
on
maybe we need to look at, we'll talk offline because I just saw the email that the board was sent and the second email that did have that on there. So I don't know how the rest of them got it and you did not.
I don't either, but guess what? I used what I had, and I want to make sure that it's clear that we need to be talking about these issues before they blow up again. And even if it's not on an evaluation or even in the contract, we need to be clear that we give you good direction so that you can lead. We don't ever need to be in a position where we're having to rush to do things to get it done for our children, to make sure that they're safe and that they're educated properly.
Okay, board members, if we're done with that discussion item, we have approximately 56 minutes of non-agenda speakers that are recorded. Mr. Superintendent, if you have some of your staff here that doesn't need to be here, feel free to.
Anyone who needs to leave at this time, you're free to go because we'll be listening to the rest of the meeting. And we will adjourn after the listening, Mr. Chairman.
Yeah, I'll try and remember to do it this time. Kevon, would you start the recordings with Mr. Martin?
My name is Drew Martin. I'm the Conservation Chair of the Loxahatchee Sierra Club, which is the local Sierra Club group that represents Martin, St. Lucie, and Palm Beach counties. I live in the city of Lake Worth Beach. I have two comments, both on non-agenda items. My first comment is I am concerned about the opening of the schools in person and concerned that it could increase the spread of COVID-19 virus. I am particularly concerned because I believe that the virus is still active, and I'm concerned that it will or has the potential to increase the spread of the virus amongst the general population. I also think it's difficult for teachers who may have health risks or are being required to attend schools in person. My second comment has to do, again, with a non-agenda item, and this is the burning of sugar cane in the agricultural area in western Palm Beach County. It is common practice to burn sugar cane prior to harvest. However, I'm concerned that the burning of sugar cane near schools could affect the health and welfare of the students as well as the teachers and other employees. I think the burning of sugar cane is an archaic process that has been proven to be unnecessary, that we can move forward with the mechanical harvesting processes and green infrastructure processes that are used in places such as Brazil. So those are my two comments. Thank you for listening to my comments. Again, I'm opposed to the burning of sugar cane near the school facilities in the western parts of Palm Beach County in agricultural communities. Thank you.
Hello, my name is Robert C. Mitchell, a current resident of Belle Glade, Florida, and this comment is for a non-agenda item. I have a family member that is suffering from asthma right now, and it concerns me that our school board in the sugar industry is not concerned enough with the health of our kids and our community. We are in the middle of a pandemic, one that is all over the world. So it would seem to me that it would be common sense that anything messing or causing problems for people with respiratory problems, that thing would, if it could be put on hold. And we have several solutions that can actually consider the community during this time that normally would be the burning of the sugar cane. So I would love to see, and I'm asking the board, as you hear my voice, to please consider our kids, put them first, and don't put the sugar industry first. You know, this is a community, and we're a community of people that are neighbors. And I don't want to see my neighbors, I don't want to see my family, and definitely not our community as a whole continue to suffer with something that cannot be done. So to the board, can you answer for me? Why can they not burn sugar cane? Why can they not turn the pipes to the east? Why do they not burn close to Walmart in Clewiston? If you can answer those questions for me, please, whatever the reason that they cannot do it there, I would like for you to create it and make sure that they cannot do it also in the Glade as well. Our kids, again, are our future. Our community is our future. And I'm hoping that you guys will consider that. And thank you so much for taking out the time just to listen to me. Thank you, board, and you have a blessed day.
Hi, my name is Sarah Johnson. I would like to start by saying I was born and raised in Palm Beach County and completed K-12 in our public schools. Looking back, I know that I received an excellent education. Now I have worked for this district as an educator for 14 years. I have always been proud to work for this district and felt that we had competent leadership at the district level. I can no longer say that. Over the past month and a half, I have been disgusted and truly embarrassed by the lack of leadership and what feels like total incompetence at the district level. Dr. Fenoy, we are tired of hearing your excuses that no one has ever done this before. That was an acceptable answer in March, April, and May. That is no longer acceptable. You have had 6 months to prepare for this, yet in mid-September, you have done nothing besides create a logistical nightmare for administrators and teachers. Last week, you shared the budget was the only thing that actually kept you up at night. Considering our current situation, that feels like a slap in the face. Let me highlight some failures and issues that should be keeping you up at night. First and foremost, you failed the entire district when you waited to ask parents to make their choice until after the school year started. When asking for their choice, you gave them basic CDC guidelines that were readily available in July. Many other Florida districts had a cutoff date for choice in July or early August so they could properly plan for the school year. Dr. Fenoy, you stated that you don't know of any other county that are pairing students and teachers with virtual or brick and mortar. This is simply untrue. Please refer to the Leon County website. Parents made their choice in July. Teachers and students were paired off, and no simultaneous teaching is occurring. You released your plan on how simultaneous teaching will look 4 days before school opens and only 1 day before ESE classrooms open. You showed how to set up a smart board, but logistically, how will this look and be effective in a kindergarten or ESE classroom? How will both sets of students receive that excellent education they are entitled to? I assure you the child's education will suffer in this model. Finally, the most egregious decision that you did make this month was allowing parents to change their choice whenever they want. Are you and Mr. Oswald so far removed from the school setting that you do not understand how this will negatively affect the operations of a school? You have created this logistical nightmare, dropped it in the laps of principals to figure out mid-September, and then you want to allow this nightmare to reoccur every week. Having parents make a choice and stick with it for at least a trimester is the only way schools are going to be able to function properly. To reiterate how atrocious this decision is, let's take a look at other counties and when their parents are allowed to change their choice. Alachua, every 9 weeks. Brevard, 9 weeks. Citrus, semester. Duval, grading period. Flagler, semester. Hillsborough, every semester. Leon, 9 weeks. Manatee, 9 weeks. Pasco, every semester. Sarasota every semester. I implore the board to address this decision regarding parents' choice and their ability to change it every week. I would like to finish by reminding the board about the call.
My name is Maria Elena Garcia. I am speaking on the topic of allowing teachers with a vulnerable family member to work remotely. I have been a teacher at Okihili Middle School for the past 10 years. I have an adult daughter with autism, so I filed a request to work remotely. My request was denied. I have appealed. I am the only family member and caregiver for my autistic daughter, Naya. As reported on the letter from her doctor, Naya is a nonverbal person with autism who also has a seizure disorder. Due to her developmental disability, she frequently has elopement behavior. My daughter needs constant supervision to prevent her from eloping, and she needs help with vital living functions. Even though she is 19, she is unable to prepare meals for herself, and she needs assistance on daily living such as showering, toileting, and dressing. When I talked with her case manager about what will happen if I were to contract the COVID-19 virus, she told me that we will both have to be isolated for 14 days. And after that, if I was still sick, we will have to see if there was a group home where she could be placed temporarily. It is impossible to isolate myself from her when I have to prepare meals for her, supervise her general safety in the house, and assist her with all daily living functions. If she were to contract the virus, which is very possible since I cannot be isolated from her, it would be very stressful and unsafe for her and for me. Due to her developmental and language impairments, she cannot express how she feels. At this moment, I have appealed the denial of my request. Since I am the only provider for myself and my daughter, I will be forced to go back to work in the school building in order to pay for our living expenses. The denial of my petition to work remotely will put my health and the safety of my autistic daughter at a very high risk. Again, my name is Maria Elena Garcia. I am a teacher at Okihili.
My name is Steve Messam, and I'm calling on a non-agenda item. I wanted to make sure that we are aware that out in the Glades, we have Rosenwald Elementary School, we have Gove Elementary, Pioneer Park Elementary, Glades Central, Canal Point, Pahokee Middle Elementary, and High School that are surrounded by sugar fields. And starting October 1st, sugarcane fields that surround the schools in the Glades will be set ablaze, releasing toxic pollutants in the environment that endangers our students over the course of 6 months. Many of our students suffer from respiratory issues, including my 6-year-old first grade son, who attends Pioneer Park Elementary School. These respiratory issues include asthma. And the CDC guidelines back in June actually recommended that temporary ban of burning of agricultural fields, which includes sugarcane fields, be considered in this upcoming flu season, which is in the heart of our school year, because of the increased risk it has for children, pregnant women, and the elderly. We're asking that the sugar industry be good neighbors for us out here in the Glades industry and practice green harvesting instead of burning the cane, which rains down black snow and those toxic pollutants on us. It not only affects our people, it also affects the facilities. I think it was Board Chair Barbieri who saw the deterioration in Pahokee High School. And most of that is due to the exposure of the constant sugarcane pollutants when they're burning those fields that impacts mechanical systems and the like. So we're just asking that the school district to petition the sugar industry to practice social distancing by green harvesting instead of burning those sugar fields during this upcoming harvest season, which rains down black snow and pollutants on our students, staff, and facilities. You guys have a lot on your plate, and I'm sure that you guys are caring about our children and our staff and the teachers out in our schools in the Glades. But also, just be reminded that with COVID-19 and the increased health effects that the burning of these agricultural fields present is another added thing that we have to deal with out in the Glades. And I know that the school district leased land to U.S. Sugar for Rosenwald next to Rosenwald Elementary School. We're just asking them to be good neighbors. And instead of burning those fields, to green harvest those fields so it can keep us safe from a health issue and just from a quality of life, not dealing with those smoke and pollutants that will cause us to spend more money on pressure cleaning our home, having to pressure clean the schools and all the other maintenance things that increase costs for the school district. Thank you for your time. Be safe and God bless.
Hello, my name is Megan Bell. I am a teacher and a parent here in Palm Beach County. I also was a student at Palm Beach County Schools for most of my life. So I am calling today because I'm very, very concerned at the chaotic and disorganized situation that's happening surrounding school reopenings. Although my principal has moved mountains and done Herculean tasks in order to maintain student and staff safety, she has been hamstringed at every moment by the district's and the school board's ineffective and inefficient method of maintaining safety while we reopen. I believe that thousands of teachers applied to have distance accommodations because it is unsafe to begin in-person instruction at this time. So beginning in-person instruction presents a clear health danger to thousands of our employees, and that is why they applied for accommodations and their doctors agreed. More than half of parents and students in our school district, including myself, have decided that it is unsafe for our children to gather in large groups for hours and hours at a time at this moment. So I understand that the school district is feeling pressure from the state, but this is an illegal order that the governor has put upon our counties, and that is why it is in litigation right now. We should not be attempting to reopen in-person schools at this time because it is not safe and because there is no safety mechanisms that have been put in place by the district that would make it safe. So please consider pushing the start date back, consider keeping everyone using distance learning, and thank you for your time.
Hi, this is Catherine Martinez. I'm a retired teacher. I live in Belle Glade, but I taught at Pahokee High School. I would like to speak to a non-agenda item. Given the fact that we are coming up on sugarcane harvesting now in October and all the dangers from COVID-19 and bad air quality, I would like the school board to address the issue of the burning of cane in the area around Belle Glade, South Bay, and Pahokee. I personally have seen black ash floating through the atrium of Pahokee High School. Pahokee Middle School. And it is appalling that the school board is continuing to support this practice, especially because they receive financial support from the sugarcane industry. I've also walked out of my house in Belle Glade and seen my car covered with black ash. And you can know that if the ash is in the air that way, it's going to affect people's quality of life and any health condition they might have. I would like to encourage the school board to look at the possibility of working with the sugarcane industry to use regenerative agriculture and also to use non-burning methods of cane harvesting These are being done in Brazil, they're being done in Louisiana, and I think that we need to look at that here. So I would definitely like the school board to look at this issue, and please think about the health of our students. We need to put student health before any other considerations, especially now in this time of COVID. And, the South Bay School, while it receives money from renting the sugarcane land, we also have to think about how much this can affect the health of the students that attend the school. So, as I said, I would like the school board to look at ways of working with the sugarcane industry. We're not looking to shut down this industry because this employs people in our area. What we would like to do is to look at environmentally friendly ways of harvesting the cane, and there are also ways that we can use the bagasse and these other materials to use different kinds of. Thank you very much, and I appreciate your time. Bye.
My name is Rhonda Bogotsky. I'm calling as we have a student in Palm Beach County School District 6. I am calling for representation to retain School Superintendent Donald Fenoy. I have been contacted multiple times directly and personally by Mr. Fenoy for concerns that I have having a special needs child in the Palm Beach County School District. Mr. Fenoy has been dealt with times that are uncharted waters for anyone in our Palm Beach County School District. He is fighting to maintain the framework and the integrity of the system that we have up in place for the principals and staff in our school. It is detrimental to retain School Superintendent Dr. Donald Fenoy for the stability of our children and the integrities of the future of our schools. Please put in my vote as retention for School Superintendent Donald Fenoy. He is doing an amazing job. Have a good day.
Good evening. My name is Eric Cahill, and I would like to address the non-agenda item I like to call the Palm Beach County School Board Soup Sandwich Plan. This is the plan that you will implement next Monday. 7 months this council has had to be leaders, thinkers, and pioneers of an innovative blueprint for an ideal school opening, an opening to be proud of for less than an ideal situation. We could have had a 7-course meal plan full of delicious virtual and classroom teachers, spiced with relevant summer training for teachers, featured with succulent and savory safety measures, completed by satisfied parents and top performing students. But instead we waited and waited for someone else to implement a plan that you spun into the soup sandwich plan that we are adopting Monday. But we can't dwell on the past, and we can't cry over spilled milk, so soup sandwich it is. So, Monday morning, when you are drinking your coffee at your desk and high-fiving, oh wait, that's not socially distant, Zoom saluting each other, teachers will be arriving at school earlier than conscious in order to ensure students are able to stay socially distant and enter their bland classrooms, sitting at their desks with or without a computer, devoid of bookcases, of books, and other shared tools for tactile education stimulation. These students will wear masks dependent on parental mandate, since the school board stance on parents and students is to hide in the corner and avoid eye contact. Let them have whatever they want, and they are always right, and the teacher's always wrong. Come to think, your stance with teacher is tell them whatever they need to hear and strip them of any self-dignity later. Supporting them is not required. Here's where it gets good. Here enters your teachers, those employees who deserve most but get only what budget scraps you have left for them and their classroom. These people are the heroes that will do their best to make this soup sandwich plan and fabricate it into a 3-course meal, salvaging this school board of possible humiliation. Monday and every day, these teachers will most likely be stretched to an unsustainable limit and mentally break down. You council members will probably be home with your virtually educated kids and done with your dinner before a tired and tattered teacher will make it home to their family, scared to set foot inside after spending a day managing 2 classrooms face-to-face and virtually, eating within their vehicles, cleaning like a janitor with their annual supply of 400 wipes, exposing themselves to COVID without inadequate personal protection. All this inside a classroom thrown together to accommodate as many students as possible. And what will they eat before crashing for the night? Probably a soup sandwich dinner. Why do they do it, Dr. Fenoy and council? It's not for the pay. It's not for the parental wavering support. It's not for the school board, and definitely not for your less than motivational speech for teachers, Dr. Fenoy. It is for the students, which this council forgot. The students are the reason we teachers band together in an attempt to make your soup sandwich plan look good. No confidence, Dr. Fenoy. Lead from the front, not the rear, in order to quietly raise your own self-serving salaries.
Hello, my name is Ann Haskell, and I live in Belgrade. I'm speaking on a non-agenda item. With October 1st starting the sugarcane burning season, I am hoping that the school board will consider your role in supporting the sugar industry's disregard for our students' health. This needs to be addressed. Thank you.
My name is Kimberly Mitchell. I'm the Executive Director of the Everglades Trust and a lifelong resident of Palm Beach County. Good evening, school board members and district staff. In some form or fashion, I've been involved in Everglades restoration since 1994. One of the harshest practices of the industry, the sugar industry, is their preferred method of harvesting the cane. This cheap and archaic method chokes the air with chemicals and soot. Every year from October through May, they set fire to more than 400,000 acres in the Everglades. I've stood in Pahokee during the sugarcane harvest season. I felt the heat of the flames and gagged on the smoke. I've gotten nosebleeds and headaches from the toxins in the air. I've washed the black snow from my car. I cannot imagine what it would be to live there, and I cannot, for the life of me, imagine how this could be tolerated any longer. I say this for myself and on behalf of the Everglades Trust. Black Lives Matter. Not only does the polluted ash rain down on nearby communities, it is directly affecting the health and quality of life for low-income communities of color. This is not harmless farming. This is industrial-scale desecration of the environment, and it is exacting a horrible toll on innocent families living in the middle of it. The CDC has recommended a complete ban on agricultural burns in light of the pandemic, COVID, a disease of the respiratory system that has already exacted a cruel price in the Glades communities. Keep in mind, this is a disease so scary, it has all of us participating in this meeting remotely and me by a pre-recorded message. There's only one office holder in Florida who can permanently bring an end to this, the Commissioner of Agriculture, Nikki Freed, and we are calling on her to do so. But right now, the school district is an active participant in these burns, and you can do something about it. So I ask, who among you is willing to put Glades families ahead of the bottom line for the sugar industry? Those are my comments. Thank you very much for your attention.
My name is Suzanne Alonzo. I'm a parent as well as a teacher within Palm Beach County Schools. I am commenting on the lack of preparation for reopening the schools, and I wanted to express my concern that although the date may have been sooner than we anticipated, I'm disappointed that there were not 1, 2, 3 different versions on how to reopen the schools. It feels like we're starting the school year blind, deaf, a little dumb, and it's becoming increasingly difficult to best serve our students when we cannot fully prepare. I know this is a difficult time for everybody. I don't admire anybody in these decision-making positions. However, This is a time when decisions have to be made.
My name is Terry Williams, and I will be speaking on a non-agenda item. I'm going to be speaking about the priority application process for teachers to apply for remote positions within the district. I reached out to the Human Resources Department so I could best understand the options available to me and how to best pursue the application for priority status. I would like to read to you the questions and the answers that I received from the district Human Resources Department so you can understand my concern. Here's the first question that I asked. When will I be allowed to apply for a lower priority if I'm denied at a higher priority and want to pursue an appeal? The response is after receiving a response from the panel on your initial inquiry. Second question, do I have to wait for the end of the appeal to apply for a lower priority status? Yes. So those two alone are in conflict. According to the response from the district, after the response is received from the initial inquiry, I can apply for a lower priority. But then the very next question, they tell me I have to wait for the end of the appeal process to apply for that lower priority status. That's one problem that I have. Here is the third question. Will the appeal be heard and resolved prior to the allocation of the remote positions? This is the most disturbing response. No information is available regarding the actual appeal process. Let me repeat the response. No information is available regarding the actual appeal process. My next question, if the appeal is denied and I reapply for a lower priority, will I be placed at the back of the line because my new application was turned in later than others, or will my place be according to the time I originally filed my first priority application? Once again, the response is no information is available regarding the actual appeal process. I asked a couple more questions. I won't read them into the record now, but let's suffice it to say that the answers are no information is available regarding the actual appeal process. My concern is how can I make the decision that is best for me, my family, my coworkers, and my school if I don't even have an entire process to review and understand before making a decision. I'm very disheartened that this was not thought through way before now. I'm not here to assign blame. I'm here to ask for clarification. What is someone to do in this position? Please speak to us and tell us what we should do when we don't have a complete process in order to make a decision.
My name is Rochelle St. Louis. I have 3 children attending school in this district. I'd like to address the recent noise from the CTU calling for the firing of Dr. Fenoy. This is wrong and unfair and will not solve anything for the betterment of our students. Fenoy, all school district employees, principals, teachers, parents, and students are in an impossible situation. Firing him will make managing this problem that much more difficult. This should not even be up for consideration, and if it is, this same heat and pressure needs to be applied to Ron DeSantis, Cochran, and every single elected school board member should also step down because Fenoy is not making this decision on his own. And to the parents, understand we're all not going to get what we want. The district has to do what's best for all children, not just your own. Stop making unreasonable and impossible demands that only serve your child. Thank you.
Hello, this is Reverend Amicus Vial. I'm calling in regards to the request to have Fenoy resign. I'm 100% behind this. There's been no plan. I cannot understand why this man would get up in front of a camera and say the words he said to teachers last night. This conveys a complete lack of respect for the profession, for the community, and for our children. Furthermore, his lack of planning, his lack of empathy, his lack of professionalism is a stain on Palm Beach County, the school board, and the education profession. I hope the board will consider Mr. Katz's request to accept his resignation and have him removed from office forthwith. Thank you.
Hi, my name is Dana Torres, and I'm submitting a non-agenda item comment.
I'm calling in regards to the sugarcane burning that is posing a serious health risk, especially in the light of COVID-19. The CDC has recommended a complete ban on agricultural burns during COVID. With that said, the school district is leasing land to the sugar industry, knowing that they're going to be burning the fields surrounding the school every school year. And it's been causing a lot of hospitalizations of the students in the past. Nebulizers are having to be used constantly at the school, and some of the teachers have had to quit their jobs because of this risk. If the school is going to continue to lease this land to the sugar industry, we're demanding that you include a provision in the lease to ban sugarcane burning on the fields and insist that green harvesting is used instead. This green harvesting is being implemented by other corporations, by predominantly white neighborhoods, so there's no excuse and no reason why it can't be implemented in predominantly black neighborhoods. We've seen environmental racism go on throughout the country, and it's not going to be allowed to continue to happen here. I hope that the school board steps up and makes these demands for their students, for their children, our children that are living in this community and in this county, and we're not posing additional risk to them because people want to continue to make their profits. So I'm asking, please,
Hello, my name is Sister Laura Kavanaugh, and I am a Sister of the Blessed Sacrament. I have lived in Belgrade and ministered in the Glades community since 1994. As the fall season begins for all of us, but here in the Glades, it is a season when the sugarcane fields will again be burned. I'm sorry, I forgot to mention this is a non-agenda topic. This is regarding the burning of sugarcane fields in the Glades area. It's burned near our communities and our schools, probably for about the next 7 months. This is during the current pandemic when our already very vulnerable population is exposed to the additional risk factor of respiratory toxins. I lived with Sister Ann Meehan, who is another sister here. She was a school nurse in Belgrade and South Bay, and she remembers and tells me about during this season how many, many children were constantly be coming into the nurse's office, and she kept many, many of the inhalators ready for the kids. I realized that the Glades Public Schools have kept windows closed, and you have limited the outside exposure to the smoky air pollution. But every day, I worked with after-school kids a lot. I was the director of Glades Kids for many years, and I work with the kids in the neighborhood still. I see kids walking to and from school, playing outdoors, and going home to apartments with no air conditioning. They are breathing through windows. Actually, I do that too, and I have asthma, but it's not the best. I find it really hard for me to believe that the school board has not joined in supporting those who are calling for a buffer zone around the cities of our Glades communities to prevent the smoke, the burning up close. When it comes to choosing between healthy communities, schools, and children, or facilitating the sugar companies' desire to keep on burning, just as it's the easiest way to go, I wonder why is this so difficult for the school board and why you would hesitate. Perhaps it's because the school district is actually leasing land to the sugar growers where they continue to burn near our schools, actually. Is there anyone on the board who is capable of addressing and doing anything to protect our children? Thank you.
Good morning, this is Dominique Foston. I am a parent in Boca Raton. I have 2 children who are in the Palm Beach school district. One is in middle school and one is starting high school. And though I understand that this has been a difficult time for everyone, I realize that the teachers union is calling for the superintendent to be removed. And I would like for everyone to take into consideration that
at this time, though everything is extremely difficult for both parents, teachers, and administrators, this would only further confuse any potential we have to have some kind of order. Parents are indeed suffering, not everybody can stay home. Teachers have to attend to online as well as students in the class when we return on the 21st. But this will not solve anything, as we would, if we move forward with removing the superintendent, all we're going to do is create a situation where there's now a void, further chaos, and the children and teachers would suffer even more. Thank you for taking this into consideration.
Good afternoon. This is Dr. Jeff Van Trees, Law Academy teacher at Palm Beach Lakes High School, adjunct professor of business law and environmental science at Palm Beach State College, and attorney of counsel at Zeplo and Farwell, PA. The school district continues to openly defy Article 9 of the Florida Constitution, which requires that schools be, quote, safe, unquote. The fact that this board has continued to meet remotely post-Phase 2 reopening is proof positive they have no conviction whatsoever that conditions are safe to reopen schools. What is particularly egregious is that the remote work option is now being shifted from the district to principals, who are now being asked to violate Article 9, thereby putting themselves in peril of legal action being taken against them. I take particular issue with Dr. Fenoy's statement that he can't please everyone. This board and the superintendent have a duty to follow the Florida Constitution. This is true regardless of who is pleased or unpleased by following through with that duty. The political pressure to provide child care is the only driver behind this reopening, and the district is violating our Constitution in order to placate those that are more interested in babysitting than whether students and teachers live or die. However, this political pressure will shift significantly once people start dying, and these hollow excuses will no longer suffice once the damage from this horrible virus starts taking effect. Thank you.
My name is Emmy Kenny, and I have a non-agenda item comment for the school board. It's come to my attention recently that the school board is leasing land to the sugar industry next to Rosenwald Elementary in South Bay, knowing that each harvesting season, the sugarcane fields directly next to the school will be burned. And as we all know by now, sugarcane burning poses a serious health threat to anyone caught in the smoke and exposed to the fine particulate matter in the air. And this has caused students to be hospitalized in the past. Teachers have reported the constant use of nebulizers and inhalers in the classroom. Some teachers have even had to quit their jobs and move for the sake of their health. The CDC has recommended a complete ban on agricultural burns in light of COVID-19, since even a small amount of air pollution can make COVID more deadly. And this shows just how dangerous this practice is right now. And there is a healthy alternative, green harvesting. It's already practiced around the world and in some fields in the Glades, including the field next to Walmart in Clewiston, because when the Walmart was built, they demanded that there be no burns on surrounding fields for the sake of their business, and they used green harvesting instead. So if the school board is going to continue leasing this land to sugar, there must be a provision included in the lease that bans sugarcane burning on those fields next to Rosenwald. There's absolutely no excuse for putting your students and employees at heightened risk for profit ever, especially during a deadly pandemic. And for years, the school district has allowed this to continue, even paying for the custodians to clean up sugar's mess and designing a new school that would allow students to move around campus without having to go outside because of the burns. So it's time now to stand up and finally do the right thing. A failure to act now jeopardizes students and teachers more than ever, and no amount of profit is worth that. So either stop leasing school property to sugar or demand that they stop burning on the fields next to Rosenwald Elementary.
Hi, this is a non-agenda item for tonight's meeting. My name is Catherine Toms, and I'd like to leave this message. I live in Delray Beach, and I'm a physician and a mother. I'd like to take this opportunity to thank the school board for their hard work and dedication in preparing for the return to school in this pandemic. My daughter suffered from childhood asthma, so protecting children from harmful pollutants is near and dear to my heart. I want to ask the board members to reevaluate the school board's relationship to the sugarcane industry, specifically the leasing of the property adjacent to Rosenwald Elementary School to sugarcane fields. please call for a stop to sugarcane burning this fall, especially during the COVID pandemic. And I urge you to use your power to urge sugarcane companies in Palm Beach County to adopt clean, economical, burn-free practices and keep our children's health in the forefront of whatever you do. Thank you so much.
Yes, my name is Gloria Shuttlesworth, and I'm calling in support of Dr. Flournoy. We just got him in and settled and doing what's the best for our students, and this is not a tried and true mechanism for any city or a state. My grandchildren went to school and they have contracted the coronavirus out in California, and I don't want the same thing to happen here in West Palm Beach. Please take this seriously. Thank you very much.
Good afternoon. This is Dr. Angela Shuttlesworth of Be Lead Grow, a certified minority business enterprise within Palm Beach County, and also as a resident. This is in response to the attempt to call for the resignation of Dr. Flournoy. In addition to public comment, I want to highlight that I have witnessed this superintendent be extremely open to the feedback, needs, concerns, desires of not only students and staff and administration, but also his community partners and leaders. I have seen and witnessed a unprecedented desire not only for quote-unquote dealing in crisis, but for also looking at innovative ways to partner to be able to fill the gaps. We have been made aware of a lot of things that were issues with inequity prior to this pandemic. However, we've been able to say, okay, what are some things that we weren't doing in the past that we can do in this moment? For that reason, I feel like we need to pause for the cause. So yes, of course, it's easy to say that, just get somebody out of here. We need somebody new. However, I want us to pause and ask the questions, has he been open to communication? How has he articulated and been a feedback loop for the community, residents, administration, being aware of what's happening around the country, but also being aware of our unique needs right here in Palm Beach County? How he has been able to demonstrate empathy and decision-making in the midst of a crisis. I feel like those are things that are important when we look at healthy leadership, and it is our desire as community members to make our voices be known as well, to say, yes, our children matter, the experience of teachers and staff matter, and we also know that we want to be safe, right? We want to have options, and the belief, lastly, I'll say, the belief in the principles to be able to make decisions, knowing what they have access to as far as resources are concerned, knowing that they can make a request, right, beyond what they have in this moment is something that we want to be aware of, that there are systems put in place. And so when we are talking about firing Dr. Flournoy, we're not just talking about firing him, but we're also saying, okay, let's go ahead and destroy these systems that have been worked on and planned. Again, if it's not. And in closing, I thank all of us for our willingness to be open and to listen and to give ourselves permission.
My name is David Shanzer. I am the spouse of a Palm Beach County school teacher with underlying health conditions. So cases and deaths went up today, but you forge ahead. Dr. Alonso is concerned that without rapid testing in place, schools will create a large spike in infections. Those potentially lead to severe illness, chronic conditions, and death, but you forge ahead. This week, we found out that the data from the CDC is being altered to align with Trump's messaging by HHS. The FDA falsely promoted hydrochloroquine and convalescent plasma when pressured by Trump in press events to create a false picture of breakthroughs to boost his numbers. Their credibility is shot. They've been politicized, yet those are the guidelines you've adopted in pushing schools open. There are many other epidemiological specialists you could count on instead: Hopkins, Langone, Tufts, etc. A false narrative has been created that only people with underlying health conditions are at risk. We're all at risk, particularly those with comorbidities. Many vibrant, young, healthy people have contracted this virus and ended up with chronic conditions or died. I remind you that since this is a new virus, there is still much we don't know. For example, Penn State athletes had asymptomatic illness and now months later have myocarditis, which is deadly. Yet you forge ahead as if, oh, well, we have to take a chance because the governor said we had to. Employees don't live in a bubble. Not only are they at risk, they come home to family who are then at risk. This was addressed at the 11th hour and now has turned into a complete train wreck. Yesterday, Dr. Fenoy scolded teachers as if they are somehow selfish in looking after their own health or that of their loved ones. He should be pointing at himself and the board. These accommodations should have been mapped out in May, not days before you force schools open. Many of your valuable teachers will take leaves or just resign. Others, in an effort to show their can-do attitude and let's make the best of it, will march onto campuses and risk their own health and that of their families. This is not a shortage of supplies. This is life and death and a public safety issue. Every infectious disease doctor I've heard has said avoid crowded indoor spaces with poor ventilation. Schools are the poster child of that scenario, yet you forge ahead. This borders on criminal negligence. Dr. Fenoy should be terminated immediately. I've watched the board meetings for the past months, and I keep hearing a collective sigh of, gee whiz, we're under orders from the governor and the DOE. Our hands are tied. The governor and the DOE have one goal: to deliver Trump Florida in November, and believe schools being open will allow parents to get back to work and squeeze an economic number or two, period. I imagine you all fear losing funding since they threaten you with that outcome. Show some guts. You have lawyers. Withholding funds to a district must have some legal teeth. In Des Moines, Iowa, the school board stepped up and defied the governor and remained virtual. So forge ahead, open the schools, and let's all...
Good afternoon. I do not see athletics on the agenda, but this is in regards to the athletic plan and games. It was addressed by myself and by a board member about playing football on only 3 fields. It's certainly not fair to most teams. I asked for valid reasons, and all that was mentioned was the use of artificial turf. Back-to-back games have already been played on other fields in the past, and the fact that you can schedule games on both Fridays and Saturdays is even more opportunity to spread out. It makes no sense to stay on 3 fields. Athletes want to play home games, and you are preventing too many underprivileged families from seeing their boys play ball this year, and that's not acceptable. Not everyone can travel. You are forcing most teams to travel on a bus regularly, which is counterproductive and expensive. You made the plan too complicated, so it's time to simplify the plan and be logical. Play on all fields and do right by these athletes. I also asked you about other extracurricular activities. The plan did not address these, and parents are wondering what the status is for activities such as chorus and band. Parents of middle school students are also wondering about middle school sports, as they were not addressed either. We ask that you address these issues today so parents have answers. Again, parents and athletes are trusting that you will do the right thing and utilize all home fields for upcoming varsity football games. It's important to the community and for our players. Each team should have the home team advantage at some point, and our seniors should enjoy being recognized on their own turf during senior night. This will be the last time they are there. We are depending on you to do right by these athletes. It may seem insignificant to you, but it is important to all of us, the athletes and families. It's a battle worth fighting. Thank you for your time. And this was Christine Januszewski.
Hi, my name is Christina Duckman. I'm a 3rd grade teacher with Palm Beach County. I applied for remote virtual teaching on September 8th under Category 2, and I have yet to hear back, despite talking to others that have applied yesterday or the day before and have already heard. I have an extremely supportive principal that is trying to work with me and is able to help me, but cannot until I get that approval. And I'm curious as to what happened to this 800 application a day process that we were told. Additionally, Dr. Fenoy, I supported you when you were appointed. I cried with you during your board comments regarding the death of George Floyd, and I still do. But now is the time to have your teachers back. Contrary to your video you posted yesterday, I have never stopped thinking of the children. None of my colleagues have. We work day and night on weekends, and I know you guys are too. But we really needed your support, your strength, your leadership, and I'm disappointed. I hope something comes from the meeting today that will change my mind. We're all struggling here, and we really need someone to understand that and support us and encourage us. We're in this together, but that message didn't feel like it to a lot of us. So I look forward to hearing the meeting tonight and what things will look like going forward. I'm thinking of my colleagues that are heading back to the classroom, because if I don't get this approval, I'm taking a leave of absence, which is a shame because I've already bonded with my classes and I adore them, and I don't want to leave them, and I shouldn't have to leave them, but I'm being left with no choice. So I'm thinking of everyone out there, all my teacher friends and my students, and I hope the board makes the right decision. Thank you.
Hi, this is Cindy Marsh calling. I'm calling on behalf of removing the superintendent because the way he's handled the pandemic. Well, first of all, if you're going to remove the superintendent, remove your so-called leader in the White House, the idiot. I don't even like to call his name. And second of all, they rushing out of here with the vaccine for our kids and for everybody else. Who said that's going to be okay? All of this is a political game. It's time to put political game aside and worry about the American people, the safety for our children, and making sure the CDC is up on everything and making sure that our kids do return back to school. This takes measurements. The guns is already abusing our kids and killing our kids. The president leaving out the schoolhouse. It's just like a doorstep for the devil. So if you're going to remove the superintendent, once again, I reiterate, remove that idiot in the White House because he knew about this thing. He been knew about it. And all I can say for our people is to get out and vote the right choice. Go blue all the way because enough is enough already.
Hello, this is Robert Weiner calling. I had called last week. I do not have a agenda item to speak to as I have perused the agenda. I have found no items relevant to what I have to say. So I am just speaking freely about general topics having to do with the county. First, I want to say that while I do not necessarily agree with the timing of Mr. Katz's call for Dr. Fenoy to consider resigning or to resign or to be removed. I do support that fully and believe it is the proper course of action, especially in light of his incredibly tone-deaf statement last evening. Dr. Fenoy, if you're listening to this, I did put my name in there. If you care to reach out and speak to me about it, please feel free to do so. I am more than happy to have a conversation. Beyond that, the real truth of the matter is this. As we look around and we watch and we read the news and we see what's going on, we know for a fact at this point that the Florida Department of Health is lying to us. We know for a fact that schools are not ready to be open. We saw Dr. Alonso in Tuesday's meeting with the county almost shaking at the idea of opening schools. And yet here we are with Dr. Fenoy now firmly pointing the blame at teachers, which is entirely unacceptable on almost every level, bordering on inhumane. And that type of treatment really only deserves one outcome. Thankfully for Dr. Fenoy, that outcome is prohibited by the Florida Constitution. However, to quote another black man who found problems with power and was not afraid to face them, an unjust law is no law at all. And I call on all of my fellow union members listening And I call on my union president, who I also hope is listening, to remember those words. Because without them, without that idea, without that ideal, we are not Americans. We are not who we say we are. We just follow along like dogs led around on a leash. However, we are not animals. We are not inhuman. We are humans, and we deserve to be treated as such. That is all I am going to say, because if I say anything further, it will move into the incivility zone, and I wouldn't want to go there on a recorded line. Have a very good night. Dr. Robinson, as always, thank you for your advocacy. Mr. Barbieri, as always, I appreciate every time you speak and interact with me. And to the rest of the board, I hope to one day get to actually, as I was supposed to have back on April 15th, when things return more to normal. Have a good night. Good luck.
Board members, that's the end of the speakers. Mr. Superintendent, do you have anything else?
No, sir, I have nothing else today.
Board members, do you have anything? Motion to adjourn made by Mrs. Brill, second by Vice Chairman Shaw. All in favor, opposed? Motion carries. Oh, one thing, hold on a minute. For the speakers that are listening, if the IT still has us on, the calls are set automatically at 3 minutes. I've been told by communications that there's on Facebook or social media, it's saying that we're cutting speakers off. They're timed for 3 minutes, just like speakers are at the board meeting. So if you're hearing people get cut off, it's only because the timer on the telephone call stops at 3 minutes. With that, we'll adjourn the meeting.